Turn it over now to Jessica for the roll.
Actually, before we do the roll, I'm going to turn it over to the moderator. She just has a quick script to read for members of the board and the public.
Excellent. Sorry. Thank you.
Wonderful, Jessica. Thank you. This is the moderator of today's meeting. Welcome to the Veterinary Medical Board meeting. Before we get started, I would like to remind board members and senior staff who are not speaking to mute their microphones. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute the microphones. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When the board president reaches a point in the agenda at which public comment is appropriate, public comment will be requested at the board's discretion. Members of the public can indicate they would like to make a public comment by clicking on the icon with a question mark within a square located at the bottom center of the WebEx screen. These instructions on the screen will be shared each time for your reference. In the Ask field, typically in the lower right of the WebEx screen, members of the public who wish to make a comment will type, "I would like to make a public comment," and send to all panelists. Any other communication will not be responded to. It is necessary to identify yourself in order to make a public comment. I will take comments in the order they are received. I will call on the member of the public and unmute their microphone. The member of the public will have 2 minutes to make their comments, and I will provide a 30-second time warning at the conclusion. The microphone will be muted, and we will move on to the next member of the public who has a comment. Please note that the question and answer feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the members of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. If the attendee utilizes a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. If you do not have a microphone, please click on the Communicate at the top of your screen, then select Audio Connection, then call in Audio Connection. If you need further assistance, refer to the How to Join DCA WebEx Events guide provided with the board member link. Thank you.
All right, so I will now call roll. Dr. Noland?
Here.
Ms. Bowler?
Here.
Dr. Bradbury?
Here.
Ms. Laredo?
Here.
Dr. Nunez?
Here.
Ms. Prado is absent today. Dr. Waterhouse?
Here.
Ms. Yanis?
Here.
We have a quorum.
Thank you. We'll go ahead and move on to the next item in the agenda, which is item number 2, public comment on items that are not on this agenda for today. So, moderator, would you mind opening it up for public comment for items not on the agenda?
I also have a question. I've gotten some texts from some members of the public that are trying to log in, and they said that the autofill for the password isn't working. Is there a password that public members need to join the meeting?
This is the moderator. The password for this particular meeting is V as in Victor, M as in Mary, B as in boy, 8132020.
Okay. I'll send it.
This is the moderator, and at the direction of the board, I have opened the Q&A feature for public comment. Please remember, if you would like to make a public comment, please click on the icon with the question mark within the square located at the bottom center of your WebEx screen. The instructions are being shared for your reference. In the Ask field, please type that you would like to make a public comment and send to all panelists. I will pause a moment to allow individuals to access this panel. I do have individuals that have identified they would like to make a public comment. I will start with Ashley Snook. You will have 2 minutes. Your time starts now. You are unmuted.
Hi, can you hear me?
Yes, we can.
Okay, hi. My comment's really just more of a request, and I just wanted to see if it's possible before each person speaks, if they could just introduce themselves so members of the public can easier follow along and know who's speaking. Just because on the WebEx system, we can't see through video who's currently speaking. But yeah, that's all. I just wanted to make the quick request, so I forgo the rest of my time. Thank you.
Next individual identified as Francisco May. Your microphone is unmuted. Francisco? Next individual identified is Ronald Moe. Your microphone is unmuted.
Hello, can you hear me?
We can.
Okay. I am a consumer. I am a person who owns many animals, as I call them my children, and I've also fostered many. I also am married to an animal physical therapist who is one of the best in the country. And she cannot open up her own business because of this supposed monopoly that these vets would like to do. I do not feel, just as in human patients, no doctor controls my physical therapist. I get to choose my physical therapist through referral from my doctor. And I want the same exact thing for my animals. I want to be able to choose my physical therapist for my animals. Just like there are good vets, I get to choose my vet, and I want the same for my animals when it comes to physical therapy. No doctor supervises my human physical therapist, and so it should not be the same for animals. They are, as most people know, our children, and I get to choose who I want for them, just as if I were choosing my own pediatrician for my own child. So that is all I have to say for that. Other than that, also, there is one other thing. You can
30 seconds.
You can increase brick and mortar businesses by allowing physical therapists to have their own businesses as well, just as human physical therapists have their own brick and mortar locations as well. Okay, that is all I have to say. Thank you so very much for letting me come on.
For clarification, members of the public, if you wish to speak now, it's for items that are not on the agenda. If you're calling to provide public comment for the animal physical rehab regulations, I just request that you hold those comments until that agenda item. Thank you.
Next request comes from Zane Brown. Your microphone has been unmuted.
Hi, can you hear me?
We can.
Okay, great, thanks. So I hope I'm, after what was just said, I'll make this really quick. Please forgive me if I'm on the wrong topic, but I wanted to comment basically on the same thing as Ron about regarding animals.
I'm sorry, sir. If you'd like to comment regarding physical rehabilitation regulations, I just ask that you hold those comments until that agenda item.
Okay, so
more public comments not on the agenda.
Oh, okay, so okay, I will then. I'll forgo my time, I guess, right now, and I'll hold my comments until then.
Thank you so much.
Mm-hmm.
Next request comes from Kelly Boyston. Your microphone has been unmuted.
I also need to wait then until you're going to discuss animal rehab. So can I just stay in the queue?
This is the moderator. When it comes time for that agenda item, you will need to resubmit a request to make public comment.
That is no problem. I just want to make sure I don't have to log out of the meeting and log back in.
No, ma'am.
Thank you so much.
You're welcome. Next comment comes from a Jessica Waldman. Your microphone has been unmuted.
Are turtles reptiles? Tell us!
Jessica? Next individual is identified as Carolyn Adrian. Your microphone has been unmuted.
Good morning, Caroline Adrian. I'm also waiting for animal rehab comments.
Thank you. Next individual is Jenny Moe. Your microphone has been unmuted.
Good morning. I'm also waiting for the animal rehab discussion.
Next individual, James Sims. Your microphone has been unmuted.
Hi, I put in the chat that I am waiting for the animal rehab. I will patiently wait till it's on the table. Thank you.
Next individual, Donna Roth. Your microphone is unmuted.
Hi, I'm also waiting for the animal rehab discussion.
Wonderful. Thank you so much. There are no further comments. Would you like me to close the Q&A panel?
Yes, thank you, moderator. This is the president. We'll go ahead and move on to agenda item number 3, which is update, discussion, and possible action on amendments to section 2035, article 4, division 20, title 16 of the California Code of Regulations regarding duties of supervising veterinarian. I'll turn it over to Jessica, the EO.
So members, in the memo that I provided to you, it gives some background on this rulemaking package and where we currently are right now. As indicated in the memo, the MDC has spent quite a bit of time on this language. The board also spent quite a bit of time discussing this language before approving it. When it went to agency, however, agency expressed some concerns related to the use of the term necessary. They have concerns regarding the use of extensive clinical skills and recommended training. They essentially are concerned that this is too vague and there's what they call as a clarity standard that's not met, and they would like those further defined. I think based on the amount of work that's already been into this, I do think that it would take quite a bit of time to try to do this today. And perhaps the board may want to consider giving this back to the MDC since it's originated from them to vet this further. So with that, I'll turn it over for discussion and consideration to see if you would like to tackle this today or at the MDC.
So I'll go ahead and ask the board members if they have any comments or motions at this time.
This is Dr. Waterhouse. I move that we move this issue to the MDC. There's no little hand over on the right for me to raise my hand.
I second.
Okay, so we have a motion by Dr. Waterhouse and a second by Dr. Nunez. Any other discussion by board members?
This is Kathy. I would assume that if we move it to MDC, we would bump this to sort of the top of their initial, they have a big list, of course. In order to continue moving this along, we need them to work on it.
Correct, yes.
Okay, thank you.
Okay, I don't see any other comments by the board. Madam Moderator, would you mind opening this up for public comment, please?
And to clarify again, for all those waiting for animal physical rehab, this public comment is just to this specific agenda item, and we just ask that you hold your comments for animal physical rehab until after we start that hearing.
This is the moderator, and public comment is now open for agenda item number 3. Please, if you would like to request to make a public comment, click on the Q&A icon at the bottom of your screen and type, "I would like to make a public comment," and send to all panelists. I will take requests in the order that they are received. I do have some individuals that would like to make a public comment, and I will start with Jenny Moe. Your microphone is unmuted. You will have 2 minutes and be given a 30-second warning.
Hi, I clarified in the comment that I'm waiting for animal rehab. Thank you.
Wonderful. Thank you so much. Next individual is identified as Patricia Wagner. Your microphone is unmuted.
I apologize. I too am waiting for the animal rehab agenda.
Next individual is identified as Nancy Ehrlich. Your microphone is unmuted.
Hello. I'd like to remind the board that the purpose of this conversation about changing the regulation was to discuss giving RVTs enhanced duties or restricting some job tasks from veterinary assistants. Because the conversation devolved into this is too complicated, we can't do this, and the job tasks change over time. They ended up with these definitions, which in my opinion are completely superfluous, that Section A of 2035 already encompasses everything that's in the Section D, and makes Section D completely unnecessary. So if the MDC is of the same opinion that they can't define any new job tasks that should be restricted to RVTs, then I think they should just eliminate this addition of Section D because it's completely unnecessary. That's the end of my comment.
Next individual identified is James Sims. Your microphone is unmuted.
Hello and good morning. I would comment on the process by which this regulatory review by the Department of Consumer Affairs occurs, and ultimately potentially the Office of Administrative Law that will look at it and is as minute as the term necessary, that any regulatory activities done by this board will have to pass mustard with the Department of Consumer Affairs and the potentially Office of Administrative Law for clarity, statutory authority, amongst other things, duplication and stuff like that. So I appreciate the DCA looking at this and wish the MDC best of luck in pursuing what the DCA is asking them to do. I'll reserve back the rest of my time. Thank you.
Next individual identified is Francisco. Your microphone is unmuted.
I am also waiting for the Q&A for the animal rehabilitation.
Wonderful. Thank you. And last comment is from Donna Roth. Your microphone has been unmuted.
Hi, I'm also waiting to comment on the animal rehabilitation, but I don't know what number would that be when you say it?
I believe it is agenda item 4.
Okay, thanks.
Next comment does come from an individual identified as Lee Stevens. Your microphone has been unmuted.
Thank you very much for allowing me to have the chance to speak on this. And just reading through this also seems, I'd like it to go back to the MDC because, again, it does seem superfluous. When I read through this about a supervising veterinarian shall not delegate the health tasks to someone, again, this still seems like it's kind of related to the whole animal physical rehabilitation, like someone was trying to cover the back door, so to speak. And so again, I think that this is kind of an interesting place for it to be tagged in there when I think that the regulations as they stand, it's already covered. So that's all I have to say. Thank you.
There are no additional comments requested. Would you like me to close this feature?
Yes, thank you, Madam Moderator.
You're welcome. This feature has been closed.
Thank you. This again is the board president. We have a motion and a second. Any further comment by members of the board? Then I'd ask Jessica to read the roll.
I'm sorry, it looks like Tara wants to speak first.
Okay, great. Again, no, I don't see any hands raised on the right.
So this is Tara Welch. I did not hear who seconded Dr. Waterhouse's motion.
I believe it was Dr. Nunez.
Yes.
And can we please repeat the motion?
Absolutely. So the motion is to take this agenda item number 3 and delegate it back to the MDC for discussion at the next MDC meeting.
Okay. Dr. Noland.
Yes.
Ms. Bowler.
Yes.
Dr. Bradbury.
Yes.
Ms. Laredo.
Abstain.
Dr. Nunez.
Yes.
Dr. Waterhouse.
Yes.
Ms. Yanis.
Yes.
Motion carries.
Okay, thank you. So thank you also members of the public for your patience. We are now moving on to agenda item number 4, which is the public hearing on proposed adoption of section 2038.5, Article 4, Division 20, Title 16 of CC&R, which is the Animal Physical Rehabilitation. Before we start the hearing, I would like to make a few statements. I would like to make a clarification for the board members and the public. Some stakeholders have asserted that board members did not attend the September 10th, 2015 public hearing regarding the animal physical rehabilitation rulemaking. It is important to note that a rulemaking hearing does not require board member participation. The purpose of a public rulemaking hearing is to provide the public an opportunity to present their oral and written comments on the rulemaking. Once the oral and written public comments are received, board members consider these comments carefully and deliberate on responses to the public comments, which may occur at a subsequent board meeting. Since the September 10th, 2015 rulemaking hearing was not a board meeting, the board members who were present were not identified as board members and did not actively vocally participate. Subsequently, at the October 20th, 2015 board meeting, the board members reviewed the public comments, decided to withdraw that rulemaking, and sent the matter back to the Multidisciplinary Advisory Committee, or to address various concerns raised with the rulemaking. So given the controversy surrounding this topic, we believed holding this hearing during a board meeting was appropriate. And so with that, we will start the hearing. So this hearing is being held under authority of Section 4808 of the Business and Professions Code and the procedures set forth in the Administrative Procedure Act. Today's date is August 13th, 2020, and this hearing is beginning at approximately 9:23 a.m. At this time, the hearing will be open to take oral and written testimony and/or documentary evidence by any person interested in these regulations for the record, which is now being recorded. All oral and written testimony and documentary evidence will be considered by the board pursuant to the requirements of the Administrative Procedure Act. To ensure fairness and a complete record, and to enable the board to hear everyone who is giving testimony, the following procedures will be followed. First, we ask that all persons in attendance who wish to testify follow the public comment instructions provided by our moderator. Please identify yourself by name and group, if any, that you are representing. Each person will have up to 2 minutes to present their oral testimony. All written testimony should be submitted to the board by noon today, 12 p.m. today. If you agree with another person's testimony, please indicate your agreement on the record. You do not need to repeat the prior testimony. Written testimony may be summarized orally, but please do not read it into the record. After the board has heard all public testimony, the board will determine appropriate responses that will be included in the final statement of reasons filed with the Office of Administrative Law and posted on the board's website. A complete copy of the rulemaking file will be available for review at the board's office in Sacramento. We will now proceed to consider the board's proposed regulatory addition for animal physical rehabilitation in section 2038.5 of Article 4 of Division 20 of Title 16 of the California Code of Regulations. At this time, Madam Moderator, please open the meeting up for public comment.
This is the moderator, and at the direction of the board, I have opened the Q&A panel. Again, if you would like to make a public comment, please click on the Q&A icon at the bottom of your screen and submit you would like to make a public comment and send to all panelists. I will address comments in the order that they are received. Please keep in mind that if you use profane language or inappropriate language, I will mute your microphone. You will have 2 minutes to speak and will be given a 30-second warning. I will now pause a moment to let people access the Q&A panel. Our first public comment comes from an individual identified as Kristen Hagler. Your microphone is unmuted. Kristen, this is the moderator. I am unmuting your microphone. You do not need to press it again. So your microphone is unmuted.
Okay, thank you. Thank you for the time to speak today. My name is Kristen Hegler, and I am a California registered veterinary technician, 20 years experience in the animal rehabilitation field, holding multiple credentials and board certifications. I am the president of the Academy of Physical Rehabilitation Veterinary Technicians and am considered an exceptionally qualified subject matter expert. I support the regulations for animal rehabilitation as proposed. Consumer access for rehabilitation and pain management has grown since the early 2000s. In California, there are a combined number of nearly 190 veterinarians and registered veterinary technicians, if not more, who have completed advanced coursework or board specialty recognition in rehabilitation and pain management. In comparison, veterinary ophthalmology, founded 50 years ago, has only 20 board certified veterinarians listed in the state of California. Why aren't human ophthalmologists here lobbying to treat animals and increase consumer access? Aren't they just as qualified to treat pets using the same arguments of consumer protection, access, and safety? What would stop them from doing so if these regulations are changed yet again? Precedents must be evaluated very carefully. Opposing these regulations violates RVT, registered veterinary technician, and veterinarian protected job duties. Thank you. Physical therapists will be allowed to place and replace splints, perform castings on animals, and prescribe a brace without the direction of a veterinarian. Improper placement of a medical appliance can cause significant or permanent harm and is being done on animals. I have experienced injuries to animals and would like to see this prevented. In closing, I do have other examples of injuries for medical attention that are needed by attention for veterinarians that happen and occur all the time during treatment. Accidents happen, conditions go unnoticed by pet animals and pet owners. I challenge a non-veterinarian and members of the public to recognize the subtle abnormalities in animals that pet parents are unaware.
Time has been reached. Next individual identified is Patricia Wagner. Your microphone is unmuted.
Good morning. Thank you for the opportunity. I'm Dr. Patricia Wagner. I'm a veterinarian. I'm licensed in California as well as 3 other states, and I have advanced training in pain management, acupuncture, and physical rehabilitation. My 2 statements are that non-veterinary individuals, regardless of their other training, do not have the knowledge of physiology that multiple species have and the differences between them. And quite basically, humans and dogs do not function in a similar manner. Secondly, non-veterinary trained or veterinary technician trained individuals are not educated in identification of pain in animals, and by this they could very easily injure or exacerbate underlying issues in their patients. And I think there's a great chance for harm in individuals that don't have a veterinary medical background. Thank you.
Next individual identified as James Sims. Your microphone is unmuted.
Good morning, and thank you, board, for allowing me to speak on this important issue. I've been involved in this way back since 2006, and I've been participating with this and spoke many times before the board. And I'm considered a physical therapy content expert and was assigned to the task force, the Animal Rehabilitation Task Force, as such. My comments are basically in a couple of different parts. Number one, process. There's a flaw in the process, and it's very important. And I mentioned earlier regarding the comment of the previous agenda item, where the regulation regarding animal physical therapy or any synonyms being proposed exceeds statutory authority of the licensing board. Authority must be expressly written in statute. It cannot be assumed or implied, especially when it's codified in other parts of California law. Past attempts at regulatory action to address this issue has failed miserably, and nothing has changed to make the outcome of this regulatory event today to potentially be any different. I actually stated that at a 2015 medical board meeting presided by Mark Nunez in San Diego at San Marcos, and a representative from the Department of Consumer Affairs, who happened to be there also, spoke next and concurred with my assessment here. From a professional practice standpoint, as a physical therapist, I make my clinical decisions based on my expertise. I would be offended if a board that I was licensed under would dictate the way I would have to practice as this regulation would. I don't understand why any veterinarian would support the squelching down my ability to practice independently. Thank you. From a consumer, at 7 years of practice activities of physical therapists involved in this care across the country, there have been absolutely zero disciplinary actions against physical therapists. From a consumer, I want the ability to seek the practitioner of choice that I feel could best serve my animal, and I'd like for the veterinarian to also be able to do that too. With that, I thank you for your time, and I reserve the balance of my time. Thank you.
Next individual identified as Carolyn Adrian, your microphone is unmuted.
Good morning, Mr. Sotelo, Ms. Arata, and the rest of the board. My name is Carolyn Adrian. I'm calling in from Loveland, Colorado. I'm a licensed physical therapist who has successfully transferred my skills to animal patients over 20 years ago, when there was really no such thing as veterinary physical therapy or rehabilitation in the United States. I was the first physical therapist in the U.S. hired full-time in a private veterinary practice in February of 2000. I've since established myself in this field, educating and developing collaborative relationships with veterinarians for the past 20 years. Some of these examples, I've lectured across the United States, around the world, Japan, Argentina, Sweden, Brazil, Italy, England, to name a few, at various physical therapy as well as veterinary conferences. I've written chapters and books about veterinary rehabilitation, sat on expert panels with other board-certified veterinary specialists, published peer-reviewed research papers in prestigious veterinary journals, performed pro bono work collaborating with zoo veterinarians to treat exotics. I direct rehab services for the largest veterinary hospital group in the country, and completed a PhD in canine biomechanics from Colorado State University's Clinical Sciences Department within the Veterinary Teaching Hospital, taking courses side by side with veterinary students and veterinarians. This journey has been rewarding all along the way. We learn from one another. We strive to do what's best for our patients. In collaboration with other licensed professionals, is not a new concept. We've had engineering, developing implants, performing research. And in 2007, I created a position and was hired as Director of Rehab Services. So I see the limitations in patient care in a rehab setting across the country and other states that do have common sense language that's working. Therefore, I vehemently oppose this proposed animal rehab regulations with extensive knowledge and experience that this collaboration works.
Time has been reached. Next individual identified as Francisco, your microphone has been unmuted.
Good morning, everyone. Thanks so much for having us this morning. My name is Dr. Francisco Maya. I am a physical therapist in Chicago, Illinois. I also serve as the current president of the Animal Physical Therapy Special Interest Group within the American Physical Therapy Association. And I have been faculty for one of the two institutions that teach veterinarians and physical therapists on the field of canine rehabilitation. So needless to say that I am considered one of the top experts in the field of canine rehabilitation. I wanted to take the time to talk a little bit about the common sense language. So for example, how it is done here in the state of Illinois, where the Veterinary Practice Act allows other professionals, such as physical therapists, to work under the general supervision of veterinarians. That has allowed a tremendous amount of collaboration with veterinarians in the Chicago and Illinois area who see us physical therapists as a very positive addition to the pet care that they can support for their clients. Not only that, they actually enjoy sending their patients to work with physical therapists specifically, because a lot of the times they are weary of sending clients or clinics that do also general practice in veterinary medicine, with the fear of clients choosing to stay with those clinics not only for canine rehabilitation, but for the regular need as well as general practitioners. Also, as the president of the physical therapy special interest group, I see physical therapists and students being very enthusiastic about the field of canine rehabilitation. And one of the main reasons why California needs to address this issue is because there are many physical therapists who wish to work in this field, but unfortunately they are being suppressed on doing so because they don't want to invest the time and money in their education without knowing that they're going to be able to work with animals. Thank you so much.
Next individual is identified as Erin Troy. Your microphone has been unmuted.
Morning. My name is Erin Troy. I've been a veterinarian. Can you hear me?
Was it good?
Hello?
I wrote more, but then I kept track of the time.
Yeah. Hello?
Yes, please go ahead.
Hi, my name is Erin Troy. I've been a veterinarian for 27 years, and I've been practicing physical rehabilitation and pain management for 20 of those years. I am one of the first veterinarians in California to practice APR. My priority is and always will be the safety of animal patients. APR is safest when practiced with a veterinarian on site. This has never been disputed. It is unfair to the pet, their family, and to PTs not to have a veterinarian on site. 40 hours of unaccredited classes cannot replace a professional veterinary team. PTs don't know what they don't know. Emergencies happen. We've had patients seizure as they walk in the therapy room. We've had dogs collapse in the underwater treadmill. We've had dogs in congestive heart failure that the family thought were just having an off day. We've had a diabetic crisis, and the family thought the dog had just played too hard the day before. If a vet had not been on site with these pets and families, they would have suffered. PTs may be able to take a temperature, but they can't diagnose an irregular heartbeat or a heart murmur, or check a blood pressure or a blood glucose on the patient. No, of course they can't. It's not fair to expect them to. That's why we need a veterinarian on site. Over 80% of our rehab patients come with unrecognized and untreated pain. A painful body cannot be safely rehabbed. Pain must be diagnosed by a veterinarian, and the multimodal treatment almost always requires medications, which must be prescribed and managed by a veterinarian. I am making changes in my patient medications on a weekly basis. We don't practice rehab in a bubble. Many pets come to rehab are older and have multiple diseases and are on multiple medications, none of which a PT should have to manage. It's not fair to the pet or the family or the PT to not have a vet on site to assist these patients that are panting, have blood in their urine, increased appetite, decreased water intake, have vomiting or diarrhea. We all address these on site as they happen, so the pet does not have to suffer from delay in care, and the family does not have to suffer the frustration of trying to find a vet appointment in days, or as our current situation, sometimes weeks.
Time has been reached. Next individual is identified as Nancy Ehrlich. Your microphone has been unmuted.
Well, it's hard for me to follow the previous speaker because she said virtually everything that I would say. I concur that the language as proposed is exactly as it should be. That if physical therapists would like to work on animals, then they need to get a degree in an animal science and an animal medical field, because there are many veterinarians who are extremely competent who would like to work on people, but somehow they're not allowed to do that. So I don't see that. It's arrogant that physical therapists think that they are able to treat animals as effectively as veterinary personnel. We're not in any way denigrating their skills as physical therapists. They are terrific, and we need them, just as we needed human dentists and human cardiologists to help us get our specialties off the ground. But they are not trained in veterinary medicine, and they do not have a license to treat animals. And that's really all I have to say.
Next individual is identified as Marissa.
Moderator, I need to interrupt you. This is the president.
Yes.
There has been a request by a board member that we discuss lengthening the amount of time allowed to testify, and then actually awarding those that have gone before another minute. So I'd like the board members to weigh in on this, if they would like to increase people's time to 3 minutes. You guys, can you signify by raising your hand? Do you know how to raise your hand, or do you want to just say something?
I think I think we're cutting people off a little bit too quickly, and if there's not 1,000 people in the queue, then I would like to extend it to 3 minutes.
So it looks like we have about 67.
Yeah.
It looks 67. I guess that might be counting us. So that's at 3 times 60. That's going to be about 3 hours.
Okay.
Other board members, are you? I think that Dr. Nunez is indicating he would prefer to lengthen it to 3 minutes. Is there anyone else that would like to speak up on that?
Can we first get clarification from the moderator? I know that there's over 60 people participating, but not necessarily all of them want to make public comment. Moderator, can you clarify how many are in queue to make public comment?
Currently we do have 14 individuals that are displaying as wanting to make a public comment. And then if we allowed the 3 people that I cut off due to time restrictions, you would bring that up to 17.
What's the time right now that they're allowed to speak? How much time? A minute?
2 minutes.
2 minutes? Why don't we do 2 minutes, 30 seconds, just so it's maybe not a full 3 minutes? I don't know. That's a little bit of a compromise.
I mean, with 14 people wanting to...
That's actually not that many people. 14 people isn't bad. I thought it was going to be 60. I'm fine with 3 minutes.
And this is Kathy. I was going to say I am too. I think, depending on if there are many more people that come on and it becomes, a lot of redundant testimony later in the day, we might want to reconsider, but it seems appropriate right now to be able to give folks 3 minutes.
Cheryl or Christina?
I'm good with it, with that many people wanting to comment. I'd like to hear whatever, have people feel like they're able to say what they need to say.
This is the moderator. I just want to make sure I'm understanding correctly. We are going to be bumping the time allotment to 3 minutes. And would you like me to make the announcement that if they were cut off, they can request to finish their comments?
Almost. I need another board member to weigh in. Is that correct, Cheryl?
I'm okay with it if we don't go on for hours and hours.
Okay. So yes, Madam Moderator, now I would like to request you to lengthen the time allotment to 3 minutes per speaker, and to notify the speakers that have already gone that they have an additional 1 minute. Thank you.
You're welcome. So this is the moderator, and as discussed, we will be allotting 3 minutes for all public comments. If you did request to make a comment earlier and were cut off, you can resubmit your request to get your extra minute of time. With that being said, our next public comment comes from a Marissa Greenberg. Your microphone has been unmuted.
Hi there, my name is Marissa Greenberg. I'm a doctor of veterinary medicine in California. I am speaking today in opposition of this verbiage change. I myself have worked personally with my own dog with multiple physical therapists with certification in canine rehabilitation, and have been incredibly impressed with their level of knowledge and skills for canines. I believe that their experience and training in humans provide them with insight into canines with their additional training that make it very safe for them to work on not only my own dog, but any of my patients that I refer. I would like to have a choice with who I collaborate with, and find that these physical therapists are often excellent and skilled in this profession. I personally, as a veterinarian, received no skills or training in rehab, yet this verbiage would mean that I could go and start doing rehab any day that I wanted, which I actually have less training than any of them. I think that we should be giving owners a choice and veterinarians a choice as to who they collaborate with, and what level of supervision a veterinarian is comfortable with can help them determine that choice of who they refer to. I urge people to consider consumers' choices in this. I myself drove 2 hours each direction in order to be able to have my own dog receive physical therapy because the choices are already so limited. Owners need more choices on how they want to treat their animals, and veterinarians need those options as well. That's all at this point, and I urge you to consider the opposition of this as well. Thank you.
Next comment comes from an individual identified as Zane Brown. Your microphone has been unmuted.
Hi, thank you very much for allowing me to speak. I really appreciate it. So, my name is Zane Brown. I hope you can hear me.
Let me go to the
So, can you hear me?
We can.
Okay. So, my name is Zane Brown, and I'm a consumer, and I live in California. And I just wanted to, I have a dog myself who had some physical injuries over the last couple years, about 3 years ago. And we did an extensive search. We tried a lot of different options. We obviously started with veterinarians, and just to be clear, I'm not knocking veterinarians, of course. I mean, they definitely helped they have definitely helped us in helping with my dog's physical problems. However, we did do a lot of searching. We went all over the state looking for, basically what was going wrong with my dog. We couldn't figure it out. And finally, we found a physical therapist who did several extensive exams on my dog, physical exams, and was finally able to figure out what was wrong with him, where the pain was coming from, and begin to treat it. And basically, the physical therapists we've seen since this whole ordeal have been the reason that my dog is as healthy physically as he is today and structurally. He had a very severe back issue, and it took a long time to heal. So I just, I'm really a fan of having, a lot of different options. I support having a lot of different options as far as treatment and, and who treats your dog or my dog, I should say. And that's not to say that, so that's pretty much where I'm at. I'm very, I would love to be able to choose, now and in the future, who my dog sees, especially based on, their level of knowledge, how they get along with him, how they approach sort of his treatments, because we have been down a lot of roads up and down the state, literally, and a lot of different modalities. So I support, having as many choices as you possibly can in physical therapists and things like that. And I have nothing but great things to say about all the physical therapists my dog has seen over the last couple of years. And thank you very much for your time. And that's all I've got.
Next individual is identified as Donna Roth. Your microphone has been unmuted.
Hi, I'm Donna Roth. I'm an individual. I've been a pet owner and an animal lover my whole life, and I take it very seriously, the care that I give to my dogs. I've even had more than one person tell me that they want to come back in the next life as one of my dogs, because I do really take it to heart. I've had 4 dogs taken care of by Dr. Jessica Waldman at CARE during the last 14 years. I have labs, and they come with a set of their own kind of physical problems. But the reason that I really believe that should be part of the process is that, after she opened, I brought my lab Arlo to her because he was having so much trouble standing and walking. I've had 3 dogs of my 4 dogs who have had points in their life that they could not walk as they got older. And, one of the things that happened was that during his exam, the therapist thought, and God bless the therapist, they're so wonderful, but he was breathing a little heavy. They thought that he was being lazy. And she came and she examined him and said to me, "You need to get chest x-rays." And it was the beginning of pneumonia for him. And he ended up, he had laryngeal paralysis and had surgery and had quite a few bouts of it. But had it not been for her at that moment, I don't know what would have happened. And the fact that she was trained to know that it was something that I really needed to, to pay attention to. And, I can think of multiple other times when the veterinarians there, had literally identified life-threatening conditions for my dogs. One was a mast cell tumor. Dogs have plenty of lumps and bumps, but I had no way of knowing that. And, just ranging from reflux to more pneumonia to, eye issues, glaucoma, all these different things. And I think that what's really has been important is that the ability to use medication in combination with therapies and home care. And I've had these dogs get their legs back in kind of the most inspiring way, but the proper pain assessment and understanding the diagnosis and doing those treatments at the same time really got them up and walking. And, a vet on site is a constant medical advocate. And
30 seconds.
They've been trained. They go to school for this. I feel nothing but lucky. It was the reason that I chose that facility. And, I couldn't possibly treat the physical challenges without this combined medication and physical therapy. And also their amazing trained eyes. So, I feel very strongly about it. It would make me go to a different place than that. And it saved my dogs' lives, literally. So please consider that. And thank you so much.
Next individual is identified as Jenny Moe. Your microphone has been unmuted.
Hello, board. Thank you for this opportunity to speak. My name is Dr. Jenny Moe. I've been a licensed physical therapist in California for 17 years, certified canine rehabilitation therapist for over 10 years. I also hold an animal physical therapy license from the Veterinary Board in the state of Nevada. I'm the vice president of the Animal Physical Therapy Special Interest Group of the American Physical Therapy Association. I left the state of California last year in order to open a rehab business in State Line, Nevada, and I would love to be able to serve the San Francisco Bay Area in the same way, collaborating closely with referring veterinarians for the best care of these animals. I strongly oppose this proposal. There is a huge backlog in California for pets waiting to gain access to physical rehab services. You have critical pets who literally cannot move, worsening. Time is their worst enemy. They have to wait months at times to get even an evaluation. Limiting qualified physical therapists from these services to direct supervision further limits access for these pets and consumers. I respectfully would like an explanation specifically as to why you rejected your own stakeholders' task force language as it related to PTs practicing on animals. Instead of allowing the veterinarian to decide the level of supervision, you reworked the language to identify PTs specifically as practitioners who would need additional training on canines to even work with direct supervision. This is a heavy burden to put on PTs specifically, and while you are not pursuing that language here today because you don't have the authority to do so, we would still appreciate a full explanation as to why you voted to require and call out PTs specifically to need additional training on animals in order to practice even under direct supervision. But if you are an untrained person off the street, meaning an unlicensed veterinary assistant, you voted to allow these individuals to practice under the same provision of direct supervision without any training at all. Why did you single out PTs? I do hear the veterinarians' concerns and respect their views tremendously. I worked closely for nearly 10 years in a specialty practice and greatly appreciate having a veterinarian on site. At the same time, I've been able to catch many medical issues that were missed by my veterinary colleagues in that facility. I am by no means saying that I have the same level of medical knowledge as a veterinarian. We PTs simply want to work alongside veterinarians and would completely respect their opinion if they felt a complicated patient needed to be seen in a facility with direct supervision. Speaking to previous comments about injuries sustained, I've treated several animals over the years who actually sustained further injury while doing rehab in facilities with veterinarians and technicians only. Our expertise as physical therapists, alongside appropriate veterinary rehab training, allows us a unique position to help many pets. Thank you very much for your time and consideration. I'll forgo the rest of my time.
Next individual is identified as Joanne Bach. Your microphone has been unmuted.
Thank you. I'm Dr. Joanne Bach. I'm a veterinarian. I'm a certified rehab practitioner, certified CCRT. I've been a veterinarian for about 25 years, and 15 of those have been formally practicing veterinary rehabilitation therapy. I've been an associate at veterinary specialty practices, including one of the largest veterinary corporations, and as well as veterinary rehab practices, one of which did utilize physical therapists. And currently I've owned my own veterinary rehab practice for the past 5 years. So I'm representing veterinarians, veterinary RVTs, and our pet patients. I support and agree with the proposal. And I have more than 2 minutes or 2.5 minutes can cover, so I did write a detailed letter to the board, which I submitted in support of this proposal, which I would like reviewed by the board. I agree with prior speakers, Erin Troy, Nancy Ehrlich, both of which I thought was very well said and similar viewpoints from mine. There's also a good letter by Dr. Richard Sullivan of Bay Cities that I think is worth a good review of as well. There was a gentleman that spoke earlier about having the consumer make it their choice. And we're not saying that the client and the consumer cannot have their choice in whether they see a physical therapist or a veterinarian, but needs veterinary supervision for the safety and the best interest of our patients. Every day, our veterinary patients that I've experienced in all my years of practicing rehab, need to be assessed, looked at. There's decisions we're making on a daily basis regarding our patients' care and their therapy. We're asked questions by clients and veterinary assistants and veterinary technicians every day that need to be answered most appropriately by the veterinarian. I have veterinary technicians, veterinary assistants, RVTs, that can assess patient vitals for our high-risk patients. I feel most comfortable with that and their skills with that. We have addressed at times urgent needs and pain and emergency situations that I feel are really only best serviced by a veterinarian on staff. I personally require a normal veterinary experience to have anybody work in rehab for our facility. I've only had a couple of PTs actually inquire about jobs, and they don't have any veterinary experience or coursework behind them, so I don't see a whole lot of applicants for this field personally, although I've worked with a number of PTs and do feel that they're capable and respect what they do. I do feel that supervision by a veterinarian, however, is needed. Vets are qualified to perform and assess competence.
Time has been reached, 3 minutes. Next individual is identified as Sandy Gregory. Your microphone has been unmuted.
Hi, thank you for letting me speak. I'm Sandy Gregory. I'm an RVT. I've been an RVT since 2001. Before being an RVT, I was in the human physical therapy world as an assistant, as an exercise scientist. So I have both angles of experience. I'm also an instructor at a veterinary technology program. And like so many of the other people like Nancy Ehrlich and Dr. Troy have stated, I support the language as proposed. One of the things that I have a problem with is that bandaging and casting is an essential skill for veterinary technicians. And I have taught many veterinary technicians, and being an RVT myself, I value those essential skills. And I understand how to do that while animals are not the same as people. People are, physical therapists are trained to work with people. The other issues with this too that I feel is that there's a lot of schooling that goes behind veterinarians and veterinary technicians, and this is veterinary medicine. So there's anticipatory skills and the ability to interpret and respond to animal behavior, so fear, pain, and aggression, that we get extensive training in the veterinary field, and physical therapists do not get that same training. So when an animal comes in, we have the ability to recognize those problems and can address them much more appropriately and know how to make their experience more valuable and successful. I am not saying anything to degrade the skills that PTs have. I've worked with PTs and their experience is invaluable. It's not to say any of that, but we have the advanced training. They have advanced training as well in certain areas, and it would be nice to collaborate and be under the supervision of a veterinarian when things arise, such as some of these emergencies. The other thing too is that a lot of animals coming into physical therapy or animal rehab are long-term patients. They're the geriatric ones. And I have a place in my heart for these animals. And if they are just going to a physical therapist,
30 seconds.
They're not, the physical therapists are not able to see the minor nuances of changes that are happening that can be addressed much sooner. So I have a lot more that I can say, but the bottom line is that I support the language as proposed, not saying anything about the skill level of the PTs, but supporting RVTs and veterinarians in this field. Thank you for your time.
Next individual is identified as Dick Sullivan. Your microphone is unmuted.
Thank you. My name is Dick Sullivan. I am a small animal practitioner in Torrance, California. I am a member of the MDC and a former member of the Veterinary Medical Board. I was on the board and the liaison to the MDC during the development of these regulations. My letter is in your packet, so I'm not going to repeat that information. What I will do is respond to some of the comments that are in the letters of opposition that are in the packet. After the North Carolina antitrust issue, we are all very sensitive to the comments that this legislation deprives someone of their income. This legislation does not deprive any physical therapist of their livelihood. Their license is to practice physical therapy on humans, not animals. And if they want to work with animals, these regulations allow for that too. Another comment has to do with physical therapists having additional courses, certification programs so they are properly trained to work on and care for animal patients. One of the courses that was referenced during the development of these regulations was a course in which the final exam was a take-home exam that the student had 30 days to complete with collaboration encouraged. Hardly a standard that would satisfy the educational requirements of any certification program approved by California's Office of Professional Examination Services, let alone an equivalent to a degree in veterinary medicine. At the time, another comment was veterinarians were just protecting their income stream. This is not true. We do not have animal physical rehab at our clinic. There's an animal physical rehab clinic just up the street from us. It's owned by a physical therapist. She has a staff of veterinarians, physical therapists, and veterinary assistants. If there is a consumer complaint, then the Board of Physical Therapists would be deciding on this case because the Veterinary Medical Board cannot discipline another profession's license. The Physical Therapy Board has absolutely no experience in the Practice Act or in the standard of practice of veterinary medicine. This would not be consumer protection. To adopt any regulation for animal physical rehab less than these would not protect the public, and more importantly, would not be in the best interest of our patients. And in California, why should we offer anything less? Thank you.
Next individual for public comment is Lisa Starr. Your microphone has been unmuted.
Thank you. I just wanted to give you a perspective of someone who's been doing animal physical therapy for over 15 years. I was the founder of Scouts House, one of the first facilities in the nation to offer this service in veterinary medicine. I am not a veterinarian. I am not anything other than someone who saw a wonderful need for an incredible service. My business partners, however, are both veterinarians. And at the time that we developed Scouts House, we strongly agreed, and they felt very strongly about this, that veterinarians were not sufficiently knowledgeable about or experienced with the modalities and the therapies that a rehab therapist must be proficient in, and that a physical therapist was. So my veterinarians required me to hire a licensed physical therapist for humans to operate as the director of rehab therapy for Scouts House, our business. Every patient at Scouts House, starting then and today, is required to be evaluated by one of our veterinarians and by our director of rehab therapy, who is the licensed physical therapist. But Krista Niebaum, our PT and the head of our rehab therapy program, she works with the veterinarian to do the initial exam. I think each professional brings her unique skills and training to bear for the patient, which is a wonderful collaboration that consumers really appreciate. The veterinarian performs a general exam with a specific emphasis on the patient's underlying health conditions, particularly any issues that may contraindicate rehab. And the physical therapist performs an evaluation on the animal's current functional abilities and assesses the animal's rehab potential. Together, the vet and the PT discuss the patient's case from both of their professional perspectives, and then our PT creates a comprehensive treatment plan tailored to that patient's unique functional and medical needs. It's a process that has worked very well for more than 4,000 companion animals that we have treated in over 15 years. I want to be very clear, too, that I really do support regulations that allow qualified and licensed PTs to work under the indirect supervision of a veterinarian and to allow them to work on animals after a veterinarian has established a veterinary client-patient relationship, made a diagnosis, and determined that rehab would be safe and beneficial for the animal patients. I don't think that a PT has to...
30 seconds.
I don't think a PT has to have direct veterinary supervision, and I don't support the language that we are talking about here. So I appreciate the time for you that you've given me to talk about this, but it's a perspective that's been working for 15 years, and I think you should consider it. Thank you.
Next public comment comes from Lee Stevens. Your microphone has been unmuted.
Hi, my name is Lee Stevens. I am a veterinarian. I actually am the supervising veterinarian for Scouts House, so coincidence seems to have happened here. What I would like to say to follow up is that really this interpersonal relationship and collaboration that we have is very, very powerful. It does not preclude the fact that cases are being referred to us by veterinarians because they themselves don't have the skills. I agree. I don't have the skill to do physical therapy. And after working with a physical therapist, we approach cases from very, very different perspectives. If we have animals that need further pain control, we can use things like modalities with PT, but then I also make sure that we refer back to the referring veterinarians so that animals are not lacking for pain control. Another thing that was really important was that when this practice was set up, it was set up so that we are next door to an emergency clinic. We're next door to a veterinary clinic. We made sure that even if a veterinarian was not on site, they certainly could be safely treating animals and have care that was available instantaneously. Another thing is that when animals are being assessed by a veterinarian, again, we're coming up with the diagnosis. PTs are not trained, and they know they're not trained to diagnose, but they are trained in finding the best course of action and the best treatment plan for animals. If they are appropriately certified, and then they certainly are able to recognize what's going on with animals. And if they've worked with animals long enough, they too will be able to understand when some animal is in discomfort or if there's a problem. We have RVTs. We have an RVT who works with us as well. So again, she's well qualified to assess if an animal is not doing well. So we've tried to cover all of our bases. And in terms of, there was the CVMB's stakeholder task force, which I thought are very much appropriately covered physical therapy and how PTs and veterinarians could operate together. And there are other states that have successfully worked together to allow licensed physical therapists and veterinarians to work together so that consumers had the best access to the best options as they can. And I can't tell you the number of times we've had animals come in where people are like, this is the last option. If this doesn't work, we can't get in anywhere else. But, there's not a lot of PT available, and when they can have it, and you know that you are saving an animal from being euthanized because you can get them to walk again, that's it.
Time has been reached. Next public comment comes from an individual identified as Patrick Grohl. Your microphone has been unmuted.
Hi, thank you for your time. My wife and I started Premier Equine Center in Oakdale, California 12 years ago, and we are probably the largest equine rehabilitation facility in the country, let alone the state. First off, I think you guys really strongly need to consider differentiating between the companion animals, your pets, and the equine industry, as it is such a different field. The requirements to house these animals are so different. When this regulation came out, I had at least 10 to 15 veterinarians reach out to me, contact me, and say, what are we going to do with our horses? Where are we going to send our horses? These are the owners of clinics. This is the head of surgery at UC Davis. This is, the biggest veterinarian names on the West Coast. What are we going to do with our horses? Our facility does not practice veterinary medicine. You can only get a horse into our rehab facility with discharges from a veterinarian. All their care is not overseen daily by a veterinarian, but they all get veterinary rechecks. They all, their rehab program is all discharged by a veterinarian. And like I said, you cannot get a horse onto our facility without it coming from a veterinarian. We work as an outlet for the vets. They don't have the facility or the staff to rehab horses. Obviously to keep a large number of horses on site, it takes a lot of property, a lot of facility, and we provide that for the veterinarians. Our clientele comes from all over the country. We take care of, your Kentucky Derby horses and your Olympic type jumpers, and they all come with discharges from veterinarians. This change or the changes in this, the guidelines would be a huge disservice to the veterinarians in California and to the consumer, the equine owner, as they rely on our facility and the veterinarians that refer the horses to our facility to, help care for their animals. Like I said, I think the small animal side and the large animal side are so different, and that needs to be taken into consideration. And there definitely needs to be some different guidelines. I do feel like there needs to be some guidelines on both sides. Especially on our side, the large animal side. I feel like every horse at a rehab type facility should come from a veterinarian and needs to have discharges from a veterinarian, and they need to make sure that whoever's taking care of those animals are not practicing veterinary medicine. They're not treating horses. They are not diagnosing injuries. We do not do any of that stuff at our facility, and that is how we have such good relationships with the vets, is they know that their client is still under their care, even though it's at our facility. So thank you for your time, and please consider having completely different standards for large animal and small animal. Thank you.
Next public comment comes from an individual identified as Kelly Boyston. Your microphone has been unmuted.
Just clarifying, you can hear me?
We can.
Thank you so much. Thank you for allowing me the opportunity to speak today. My name is Kelly Boyston. I am a physical therapist, a certified equine rehab therapist, and a member of the California Association of Animal Physical Therapists. I am also an RVT, and I want to be very clear that it was my training as a physical therapist, not as an RVT, that gave me the skills to perform rehabilitation, including pain, assessment in verbal and non-verbal patients, and the extensive training in anatomy, muscle function, and joint kinematics that is essential to rehabilitation. I am speaking today in opposition to this proposed regulation. We recognize that the field of animal rehab needs oversight and regulation, and we have attempted for years to work with the CVMA and CVMB towards the goal of reasonable and responsible language and regulations that would protect the consumer and pet, and at the same time, allow them access to quality and affordable rehabilitation for their pets. If the vet board is successful with defining the practice of animal rehab as the practice of veterinary medicine and not create a pathway of exemption for a licensed physical therapist with advanced training in animals to work under reasonable guidelines, my job opportunities and ability to earn a living would be dramatically reduced. This regulation would be restraint of trade. I urge you to put a stop to any regulatory effort that fails to include a licensed physical therapist with specialty training in animals as a legitimate provider of animal rehab services. I urge you instead to require language that would allow qualified licensed PTs to work under direct or indirect supervision with the level of supervision to be determined by the referring veterinarian, and to allow them to work on animals after a veterinarian has made a diagnosis and determined that rehab would be a safe and beneficial intervention for their animal patients, leaving the decision up to the veterinarian and allowing qualified PTs to practice in the range setting or on their own premises under indirect supervision, again, in cases where the referring vet has deemed this safe and appropriate, will allow increased safe access for consumers, allow veterinarians to collaborate with other licensed professionals of their choice, and allow the board oversight to protect the consumer. This is consistent with the CVMB Stakeholders Task Force recommendations and is consistent with the other states that have gone before us. Thank you for your time.
Next comment comes from an Angela Ortiz. Your microphone is unmuted.
I had written it. The only thing I added was about the RVT.
I'm in full support of the written regulations. I do feel that they fully support the consumer protection and the patient safety, especially while maintaining the VCPR.
I meant to time myself. I thought I went 2 minutes.
We as technicians, have to work under the direct supervision as a veterinarian. We can't bandage. We can't do splints. I've seen a lot of damage actually happen from PTs, so I am fully in support of the current bill. So I just wanted to say my quick words. Thank you.
Next public comment comes from Joshua Ariano. Your microphone has been unmuted.
Hi, thank you. Can you hear me okay?
We can.
Thank you. I just want to say thank you for your time. My name is Dr. Joshua Ariano. I'm a physical therapist. I've been practicing and participating in animal physical therapy or rehabilitation since approximately 2010. I feel like if this language is approved, then we are essentially limiting consumers' ability to choose quality care for their animals. Physical therapy is a collaboration between vets and us physical therapists, both with their own areas of expertise. I challenge any vet to a discussion in progressive overload or periodization or a rehab plan of care for their patients without collaboration from a physical therapist. I'm not saying we are trained to diagnose medical issues in animals. We are not. However, we are experts in developing a plan of care to improve a patient's functional mobility, address their functional impairments, and allow them to be as healthy and capable as their owners would wish them to be. I do support indirect supervision, but I do want to make it clear that I do not support this direct supervision. And I just want to say that I feel that collaboration with veterinarians and physical therapists is key. That's all I wish to say. Thank you.
Next public comment comes from a Patrick Grohl. Your microphone has been unmuted.
I'm sorry, I actually made my comments earlier. I accidentally typed in there twice. So you guys already gave me my time and I appreciate it.
Wonderful, thank you.
Thank you.
Next public comment then comes from a John Klingborg. Your microphone has been unmuted.
Hi, I'm John Klingborg, a small animal veterinarian, and I served on the MDC for 9 years. At the outset, it should be noted that physical therapists have always been welcome to provide their services in an animal hospital setting that is under a veterinarian supervision. There are 3,000 veterinary premises in the state. That means there are 3,000 opportunities for physical therapists to collaborate with the veterinarian on behalf of an animal owner and 3,000 potential locations that could provide plenty of access for the California pet owner. APR is a mainstream veterinary service. It may surprise you to learn that in California, there are 3 times more DVMs and RVTs certified in APR than there are veterinary specialists for neurology, oncology, and cardiology. I've uploaded that graph for you.
Called on me, man, I'm almost.
And there isn't an outcry from clients that they don't have enough access to veterinary neurologists, oncologists, or cardiologists. This crisis is largely manufactured by those with a vested self-interest. Moreover, we don't see those MDs in these fields try to cross over and work on animals. For some reason, this whole scope of practice issue seems to be unique to physical therapy. Let's be clear that the primary goal of those opposed to the proposed language is to allow PTs to provide APR outside of the veterinary practice setting. In part, this issue is also driven by physical therapists who have opened their own businesses working on animals, which, by the way, appears to be a violation of their own Practice Act, and by veterinarians and physical therapists who stand to gain financially through certification courses. The bottom line, this proposed language contains regulations that clarifies how physical therapists may be allowed to practice APR legally. Please support it. Thank you.
Next public comment comes from Francisco Maya. Again, you have 1 minute to complete your previous comment.
Yes, thank you so much, you guys, for allowing us that extra minute so I can finish the thought process that I was going through earlier, which is good because it ties up very nicely with the comments that have been done regarding the general practice of veterinary medicine, as long as like the diagnosis of what's going on with the pets. So common sense language that has been adopted in other states still maintains the power of doing diagnostic tests and providing that a diagnosis to veterinarians. That does not change. Much like it has worked with physicians and physical therapists in human medicines since the inception of the physical therapy profession almost 100 years ago today. If any of you have had physical therapy for yourself or a loved one, then you will know that the PT worked in collaboration, but independently from your physician. It would be completely unfeasible to have a physician present in every physical therapy clinic in the United States or in California. So I ask, why are we placing this barrier in animals getting the same level of care that we do for ourselves? Thank you.
Next public comment comes from James D'Agostino. Your microphone has been unmuted.
Thank you, Madam Moderator. My name is Dr. James D'Agostino, Doctor of Physical Therapy. And by the way, I don't practice on animals. I'm a human physical therapist. but back in 2013, like Dr. Sims, I was considered a contact expert for the California Physical Therapy Association. At that time, there was a compromise that could be had, and today there's a compromise that could be had. I believe with many of my colleagues who have said physical therapists are not diagnosticians. Once an animal is medically cleared, you should turn the PT loose and let them do what they do best if they have the advanced training. It seems that the veterinary profession has based their claim on their knowledge of physical therapy based on their advanced training. The RVT says the same. Because they have advanced training, they should be physical therapists. Each has an idea of what rehabilitation should be and could basically collaborate, I would say, together. So, as my comments were back in 2013, I think you can come to a model where by indirect supervision, after the animal has been medically cleared, is probably the smartest way to go. We said this back in 2013 when I wrote my letter to Dr. Tom Kemble, president of DVM, and it seems we're stuck in the past right now. What makes this so? Ladies and gentlemen, this regulation that you're proposed right now chooses to ignore the physical therapist and chooses to cut them out of the business, so to speak. One of the comments that I've always said is, why? How come you haven't chosen to include the physical therapist in what I would call a collegial relationship? And my apologies to the doctors who basically said this is not about economics. Ladies and gentlemen, this is about economics. Thank you for your time.
Next public comment comes from a Kristen Hagler. Your microphone has been unmuted.
Thank you for the additional time. I'll try and quickly expand on my previous comments. I would like the new board members to understand my qualifications. I participated on the Animal Rehabilitation Task Force and supported a model where a veterinary licensee, veterinarian, or RVT is present at all times during an animal rehabilitation therapy, but this was not considered as an option to address consumer protection and pet safety. My professional expertise also includes speaking internationally, editing and writing textbook chapters, and peer-reviewed journal articles. As the founder of the Veterinary Technician Specialty Organization, we had to petition to our national organizing body that there was a need to develop a specialty by meeting certain requirements. Our organization would not have joined the other 16 specialties if there was not a need. Please recognize the professional progress the veterinary profession has accomplished since collaborating with physical therapists. The American College of Veterinary Sports Medicine and Rehabilitation is leading the field in research and treatments for animals. It's time to let them lead. Please also consider the enormous fiscal aspect, which was discussed during the Appropriations Committee in 2018 for Assembly Bill 303113. The initial estimated costs were upwards of $600,000, and maintenance of that program would have been around $125,000 annually. There was a reason that that bill failed. It is not necessary. Thank you for the additional time. I forgo the rest.
Next public comment comes from a Jennifer Benton. Your microphone has been unmuted.
Great. Can you hear me?
We can.
Wonderful. I've been a physical therapist for 20 years and certified in canine rehabilitation for the past 10 years. I'm calling to oppose the language proposed. As physical therapists, we are experts at communicating as part of a healthcare team. It is the core of who we are as a profession, and we do not work in a bubble. With every patient we see, at every visit, whether they are verbal or nonverbal, we screen for red flags, and then we collaborate accordingly. That would be no different with animals. I do not believe that we need to be in the same building as a veterinarian to have a close and safe working relationship. Options for accessing animal rehabilitation are indeed extremely limited in California. I urge you to allow the referring veterinarian to determine the level of supervision needed and to allow physical therapists to practice under indirect supervision. Thank you.
Next public comment comes from Nancy Lee. Your microphone has been unmuted.
Oh, thank you. Can you hear me?
We can.
Oh, thank you. I am a physical therapist, and I have worked and been certified in canine rehab for the past 10 years. And I have worked very collaboratively with many veterinarians and have had excellent relationships with them. However, I would like to point out that vets do not have coursework in rehabilitation as part of their veterinary curriculum. In contrast, physical therapists, our sole focus of part of our physical therapy curriculum is in rehabilitation, assessment, and techniques. And we now have a doctorate degree in rehabilitation, so which provides us extensive coursework in rehabilitation, assessment techniques, and treatment techniques. So veterinarians learn their rehab techniques from physical therapists and continuing education courses. They are not qualified to supervise us because they are learning from us. With this regulation, even a new grad veterinarian with no advanced certification in rehabilitation would be considered qualified to supervise us. The Veterinary Board is a consumer protection agency. Restricting consumers' ability to access the skills of a licensed physical therapist with advanced certification in animal rehab is not protecting the consumer. It may actually be harming the consumer and their pet by forcing them to get rehabilitation care from someone who has less skills and knowledge in rehab than a physical therapist. A veterinarian with no advanced certification in rehab could just go out and buy a laser or an underwater treadmill and call it rehabilitation. There is so much more that we can do in rehab than just those two modalities. If you want to protect consumers and their pets, you should go after dog groomers who have actually killed pets instead of physical therapists who have not. PTs have been practicing in several other states without direct supervision and have never
30
injured
seconds.
or killed an animal. The same rehabilitation techniques that work on humans work on animals. By preventing us from practicing our professional skills in order for you to lock up this market where vets exclusively is restraint of trade. This is solely a money grab to prevent competition in the small but growing market. In North Carolina, the dental cleaners took the vet board to the Supreme Court and won, so precedence has been set.
Time has been reached. Next comment comes from a Valerie Fenstermaker. Your microphone has been unmuted.
Hi, this is Valerie Fenstermaker on behalf of the California Veterinary Medical Association. The CVMA has participated in numerous discussions and meetings over many years regarding the practice of animal physical rehabilitation and the ongoing illegal practice by laypersons. We are in full support of the proposed regulations. They define animal physical rehabilitation, they clarify who may render treatment, and they require that a veterinarian client-patient relationship be established. Most importantly, they provide an increased level of medical care and safety for animal patients. These regulations are the results of many thoughtful and extensive discussions, and we appreciate the fair process conducted by the Veterinary Medical Board on this matter. Thank you.
Next public comment comes from Melissa St. Rose. Your microphone has been unmuted.
Can you hear me?
We can.
Okay, great. Thank you so much for giving me the opportunity. And I'm actually a consumer, and my goal is really just to share my own personal experience and stories in this area. And since 2003 through now, so 17 years, I've had 5 pets gone through rehab. And I'll tell you that, in my opinion, it is very important to have a vet on site. 3 of my 5 pets, their lives were prolonged because a vet was on site who actually noticed different changes. In one situation, just noticing a slight change where, long story short, it turned out to be a mass and I could take care of it sooner rather than later. Another situation, where there was an infection going on, and it was the vet on site that actually noticed the slight changes and brought it to my attention so I could take care of it. So, I'm not a doctor, I'm not a veterinarian, I'm not a rehab person, I'm actually just a consumer, but in my opinion, it was very important and is very important to have a veterinarian on site because it's just these slight nuances that can make a difference and have made a difference in my pet's life over the last 17 years. So I just wanted to share that with you guys and let you know that from a consumer standpoint, these vets on site are making a difference in our lives and in our pets' lives and prolonging their lives. So, in my opinion, a vet should be on site. Thank you so much for the opportunity to speak today. I appreciate it.
Next public comment comes from an Amy Hesbach. Your microphone has been unmuted.
Yes, thank you for your time. My name is Amy Hesbach. I'm a licensed physical therapist with a master's degree, a doctorate degree in physical therapy, and I'm dually certified in canine rehabilitation. I've been an educator of veterinarians, veterinary technicians, and physical therapists, both nationwide as well as internationally. I'm a former president of the American Physical Therapy Association Animal Physical Therapy Special Interest Group. And I continue to collaborate with veterinarians and veterinary medical professionals in my rehab practice and have done so for over 20 years. I'm calling today to oppose this proposal. What I do support is freedom of choice for the consumer. I do want to make clear that physical therapists are licensed professionals. We have a code of ethics. We have a standard of practice. We collaborate with veterinarians who manage the patient medically. Physical therapists refer animal or human patients who are inappropriate for physical therapy and who have medical conditions or signs which are emergent or which would not allow for safe practice of physical therapy, regardless of whether the veterinarian is on site or not. By mandating supervision, this will significantly increase the cost of the rehabilitation service to the consumer and limit choice, creating a monopoly in this area of practice, limiting consumer choice, consumer access, and restricting trade. Veterinarians, veterinary technicians, veterinary nurses, and other practitioners in animal rehabilitation should be held to the same mandated level of competency, education, skills, and knowledge as physical therapists. I've seen soft tissue, joint, and bony injuries to pets who have been supposedly rehabilitated by practitioners who do not have the level of competency, education, skills, and knowledge as qualified physical therapists. Physical therapists should not be discriminated against and lumped together in the same group as non-licensed, non-regulated, non-educated lay people in this area of practice. Thus is my statement, and I thank you for your time today.
Next public comment comes from Stacy Defoe. You have 3 minutes. Your microphone is unmuted.
My name is Stacy Defoe. I'm Executive Director for the California Physical Therapy Association. And we did submit our letter, so I won't go too far into it, but we are opposed to the current regulatory proposal. We don't necessarily agree with the vet board's assessment that animal physical rehabilitation is defined in the veterinary scope of practice. We think this definition should be outlined by legislative action. Physical therapists possess the education and skills that are essential to rehabilitation and should definitely be included in any such action. PTs are licensed professionals, uniquely educated and trained to clinically assess patients, both verbal and nonverbal, and develop the appropriate course of rehab. And they're accustomed to working in a collaborative manner with other healthcare professionals. And we think a pathway with appropriate guidelines needs to be created for qualified physical therapists with specialty training to collaborate with veterinarians and treat animals under direct or indirect supervision. And that would be up to the veterinarian to decide. This was recommended by the vet vet board's own task force, and this process has been working in many other states without incident. So we would like to see the board withdraw the current proposal and look for an alternative solution that specifically allows qualified and licensed PTs to work under the direct or indirect supervision and to continue to treat animals once a diagnosis has been made by a veterinarian that rehabilitation is safe to continue. And so for all the reasons that we've stated, we believe that the board should provide the flexibility to allow the veterinarian to decide the level of supervision. When collaborating with a physical therapist, this would improve the interprofessional collaboration, allow consumers to have expanded choice of access to qualified physical therapists for their pet, and allow properly qualified physical therapists to practice their expertise under more reasonable laws. We think California needs to catch up with other states who have already been doing this, and again, doing this without incident. Thank you.
Next public comment comes from Jessica Waldman. Your microphone has been unmuted.
Hi, thank you for the opportunity. I'm a veterinarian with advanced training in acupuncture and rehabilitation. I have served on 2 task forces for the Veterinary Medical Board regarding animal rehab over the past 10 years. I'm a pioneer in the veterinary rehabilitation field, and I opened a veterinary rehabilitation clinic 13 years ago, and my clinic also employs physical therapists. It still does. There is access for PTs. You could just come and visit our clinic today. I've actually enjoyed working with PTs collaboratively. I see a lot of benefits. The other thing I've seen over 13 years are their deficits. From initial behavior issues or how to handle pets, PTs can't even put on a muzzle when they start working with us. Clients ask questions, a lot of questions about pain management, about prescribing medication, about how to deal with their pet's pain. They can't answer this, and they can't address this through prescriptions. PTs can't read medical records from referring veterinarians to understand the full issues. They also are not trained in reading animal x-rays. One really important thing is that PTs can neither identify nor treat emergencies or critical situations. Our patients in the veterinary rehabilitation field are not healthy puppies. These are injured pets. They got hit by a car. They're paralyzed. They're painful. They're crying. They have open wounds. They have other issues like cancer or high blood pressure. I'll never forget AJ, a 10-year-old golden retriever with a lovely family. He was working with the physical therapist who said that he seemed very tired during his exercises. Within 2 minutes, I had done a complete physical exam and found out that AJ wasn't tired. AJ was actually dying. He had a belly full of blood. He had a bleeding splenic tumor that, given my early intervention, was able to be stabilized, and he lived for several months longer, actually almost a year. The PT thought he was tired. That was my first clue. We have to make sure we keep these pets safe from a veterinary perspective. The list is so long of medical problems that arise during therapy. I've seen life-threatening allergic reactions at my rehab clinic. I see seizures every 2 to 3 weeks. I've seen collapse. I've seen hundreds of pets struggling to breathe from heart failure. The most important thing is not just for PTs to protect them and to make sure that they are feeling good about what they're able to do and what they want to do, because they do have a wonderful role in our field, but it's to protect the pets, it's to protect the families, it's to protect patients. I'm a veterinarian and I support this language, and I very much think all the work that the medical board has done to also help promote keeping our pets very safe.
Next public comment comes from Russ Peterson. Your microphone has been unmuted.
Thank you. My name is Dr. Russ Peterson. I'm an equine practitioner, also a diplomate in the American College of Equine Sports Medicine and Rehabilitation. I support what Pat Grohl previously commented. And in contrast to the companion animal rehabilitation, the scope of equine rehabilitation includes management provisions for longer-term resident care. Expectations or aspects such as housing, nutrition, preventive health, biosecurity for our accompanying residents there that are long-term, rather weeks and months, as opposed to outpatients, are important factors. Cases should be all referred by a primary clinician for specific rehabilitation exercise and supportive therapy, both for post-injury, musculoskeletal injuries, and post-surgical cases. The physical size of sites, equipment requirements, etc., that are required for equine facilities are often force them to be in a relatively remote or rural area rather than directly on site in a veterinary clinic or hospital with resident veterinarians and RVTs and staff. Therefore, the equine rehabilitation facilities may best serve their patients and the consumer expectations for safe and effective rehabilitation by having a different set of criteria for licensing and regulating guidelines than a rehabilitation facility. Primary doctor-patient should be the first step. And secondly, in the COVID times that we have, we're finding that telemedicine and other means of evaluating patients without on-site presence may be more of a factor in these equine. The development of FaceTime and Zoom and all those aspects allow us to assess the progress of the patients on a regular basis, in addition to on-site visits when necessary, or transport of those patients to a clinic or a facility for assessment and modification of their rehabilitation as it should be modified. Development of specific guidelines, regulations, and staffing qualifications for the provision of different physical exercise and therapy modalities specifically for the equine rehab and post-op patients would optimize patient care, and continued veterinary guidance, participation, and management will best optimize consumer protection
30
and
seconds.
satisfaction. The scope, thank you. The scope of services and veterinary interaction in the equine rehabilitation facilities in California is currently quite variable and warrants state veterinary direction focused upon specific needs and provisions, which are in many ways different from the companion animal rehabilitation facilities. Thank you for your time.
Next public comment comes from Sheila Barr. Your microphone is unmuted.
Hi, can you hear me?
We can.
Hi, my name is Sheila Barr. I hold several high-level certifications in canine physical fitness and conditioning training, as well as several certifications in human and animal massage. I've been serving the pet community for 15 years and was a member of the Stakeholders Task Force. I also have a background in human medicine. I have a vetted interest in this issue, not only as a paraprofessional representing myself and my clients, but as a consumer. My concerns, put bluntly, are that the CVMB insists that a veterinarian or their assistants can practice in a specialty area just because. They also insist that a person holding a degree in this specialty field is patently unqualified to practice in the specialty in which they are trained. The assertion is also that vets and their assistants don't necessarily need additional training in this field, but physical therapists do. I'd like to add that there is currently no veterinary school in the United States offering a curriculum beyond a one-day class in animal physical rehabilitation. This nonsensical hypocrisy does not serve the animals and people the CVMB is charged with protecting. It does the opposite. It puts animals in the hands of persons untrained in a specialty field. Nowhere in any other medical environment will you find unqualified, untrained persons sanctioned to practice on live patients in a specialty field. This is a dangerous and unnecessary proposal and can endanger the care of thousands of animals throughout California. It can extend the care of them unnecessarily, inflating costs for consumers. Adopting the task force's original language, which was approved by the CVMB, following precedences of other states that are successfully using a truly collaborative model, would protect consumers from this land grab by the CVMB and their primary concern, veterinarians. Please give us consumers the choice of qualified practitioners and disallow the CVMB to form a monopoly of this modality that is outside their scope according to their own Practice Act. Thank you for your time.
Next public comment comes from a Ray Grulich. Your microphone has been unmuted.
Thank you. I'm a consumer. Excuse me. I'm a consumer. Physical therapies in California must have a master's degree to become licensed. They then go on to receive advanced training to become specifically certified to work on animals. Obviously, as a consumer, this is the level of competency I want in the person manipulating the limbs of my fragile animal. I'm lucky, I know the difference, but most people do not. But these regulations do not mandate proper training for all who practice physical therapy on animals, but the uninformed consumer is none the wiser. These regulations leave the field wide open to sloppiness and abuses by less than honorable practitioners. That's very dangerous. It's clear that this would be a lucrative win for California veterinarians, which is why this fight has gone on for so long, but that by no means would make it right if this bill passes. So let's not look to the California Medical Board to protect my pet. I'm here to protect my pet. The moral high ground here goes to those who are fighting for mandatory educational standards for all who practice in the specialty of animal rehab before they are allowed to practice physical therapy on a pet. These regulations are severely lacking. This bill has to go back to the drawing board so that the people that are practicing physical therapy are properly educated. I surrender the rest of my time.
Next individual for public comment is Diane Francis. Your microphone has been unmuted.
Can you hear me?
We can.
Thank you. I'm a consumer, and having owned a couple dogs that have had serious issues that needed help and physical therapy, my experience has been that the vet that we see, that we painstakingly found, because despite everyone despite the veterinarians that have said that there are people out there that have hurt animals that are PTs, you can find that anywhere. And I can tell you that I've had more bad things happen to my animals because of bad vets than I ever have with the physical therapy that I've had to do, because I've had no problems with the physical therapy. And the previous vet that admitted that most vets can't address these issues in any way that a PT would seems obvious. They're not trained. I believe I deserve the right to decide for myself who's going to treat my animals. And it's specious for anyone to use a bad experience from a PT as a good reason for this proposal to go through. I mean, in every profession, there are bad experiences, and that should have nothing to do with it. I mean, I feel like I can go to someone and choose whether I think they're making rational decisions and whether I trust them. We do that with every decision we make about our own bodies, about our own health, and I can certainly make it for my dogs. There's huge waiting time right now to try and get in to see a physical therapist. And I mean, I think that the folks that have mentioned that this is a monetary thing that's being pushed in favor of veterinarians, I think is absolutely true. I want to be able to take my dog to where I want, and if there's any kind of problem with how they're being trained, then change that. But don't take don't take the choice away from us of what we want to do with our animals. Thank you very much.
Our last public comment comes from an individual identified as Jason Kaiser. Your microphone is unmuted.
Can you hear me?
We can.
Okay, good morning. My name is Jason Kaiser. I'm the Executive Officer of the Physical Therapy Board of California. I'll keep my comments brief. I just wanted to correct any kind of misconceptions or maybe clarify some points that were made here today. As an opener, and most specifically, currently there is no authority in the PT Practice Act that authorizes a physical therapist or a physical therapist assistant to participate or practice their art and science on animals. Business and Professions Code 2620, which defines the scope of PT practice, specifically refers to person. And for clarity on that, based on some comments that were made about investigations or complaints, should the PT board receive a complaint that involves one of our licensees and animal rehab, the PTBC would consider that complaint non-jurisdictional and would forward that complaint to the Veterinary Medical Board. In the event that the Veterinary Medical Board sanctioned or cited one of our licensees for the unlicensed practice of veterinary medicine, we may also, on a case-by-case basis and when appropriate, sanction or cite our licensee as well. Very much the same way we would if we had one of our licensees sanctioned by another board or bureau, such as the Medical Board of California, the Registered Nursing Board, Occupational Therapy Board, Acupuncture Board, or Chiropractic Board as examples. And as always, the PTBC is happy to serve as a resource in this discussion. Thank you for the time, and I will yield back the balance of my time.
Next public comment comes from a Karen Atlas. Your microphone is unmuted.
Hi, can you hear me?
We can.
Thank you. My name's Karen Atlas, and I'm a California licensed physical therapist since 1996 and certified in canine rehab since 2008. This issue is very near and dear to my heart, and I've devoted my career to the physical well-being of animals. I'm the president of the California Association of Animal Physical Therapists and the Animal Physical Therapy Coalition. The latter is a grassroots coalition representing vets, physical therapists, RVTs, and consumers, and I'm speaking on their behalf today in opposition to your proposed regulations. This is a consumer-driven industry, and California consumers have been asking for the opposite of your proposal. They want more access and more choice of animal physical therapists, not less. They also want minimum standards educationally in place for all practitioners rendering this type of specialized care, as this would truly protect them from unqualified practitioners. We noted in the Stakeholders Task Force that the veterinary profession severely lacks in any rehab education. So to not mandate any additional training for this specialty that they do not receive in their training, in their education, would not be in the best interest of the consumers. Aside from all the voiced consumer opposition with over 4,000 petition signatures and letters that were sent in by DVMs, RVTs, PTs, etc., I'd also like to touch on just two of the legal defects and deficiencies we have identified in this regulation and process. Firstly, the board's APR unlawfully enlarges the scope of the veterinary practice defined in statute. The veterinary scope of practice does not include physical therapy. When courts construe statutes and the legislative intent behind them, they look at what the statute enumerates and will not read into it as the board is trying to do here. Based upon the language of Section 4826, animal rehab is not expressly authorized as part of veterinary practice. Secondly, the proposed APR regulation violates the Administrative Procedure Act, and it fails to comply with the requirements within that act. The Animal Physical Therapy Coalition is calling for unity. We would like to see the professions working together as a team, and this cannot happen within the proposed regulatory framework. We urge the board to abandon these efforts and instead support the true solution to this issue, which would require a legislative remedy akin to what is written in AB 3013 to codify the Stakeholders Task Force language. It's important to note here that AB 3013 did not pass in appropriations in 2018, but it is noteworthy that the inflated costs included the board to
30 seconds.
to create a certification, which is simply not true of what the bill was doing. It was not creating a certification. It was just outlining needed education standards. It is also important to note that physical therapists receive training on animal pain recognition, animal behavior, animal handling, comparative animal anatomy and physiology.
Time has been reached. I just want to remind the public that if you would like to make a public comment, to please utilize the Q&A feature and not the hand raise feature, as we will not entertain the hand raise feature at this time. Next public comment comes from a GV Ayers. Your microphone has been unmuted.
Thank you. I am GV Ayers from Gentle Rivers Consulting. I represent the Animal Physical Therapy Coalition, of which Karen Atlas, who you just heard from, is president. I'm separately submitting written comments detailing additional objections and opposition to the current regulatory proposal that cannot be covered in this hearing today because of time. However, we wish to highlight the following. First, scope of practice. Scope of practice is within the sole purview of the legislature. The regulation seeks to define animal rehabilitation within the scope of practice of veterinary medicine without the input, oversight, or action of the legislature. This issue should be a part of the legislature's sunset review process and should have a legislative solution. Second, the regulation will have a significant adverse economic impact upon businesses and jobs. The regulation will allow animal physical rehabilitation solely within the veterinary practitioner paradigm and will restrain the train of qualified professionals. Legitimate rehabilitation practices will certainly be negatively affected, resulting in jobs lost and businesses lost. Third, like human physical therapy, animal physical therapy should be a collaborative effort between qualified and trained professionals, doctors and physical therapists working together on a healthcare team for the welfare of patients. The Department of Consumer Affairs and the Veterinary Medical Board and the Physical Therapy Board should also work together to develop a workable solution to the issues at hand, and which should also be addressed then in legislation. Fourth, the protection of the public. Last of all DCA regulatory agencies are mandated by law that the protection of the public shall be the highest priority for, in this case, the Veterinary Medical Board in exercising its licensing, regulatory, and disciplinary functions. There are no documented examples of consumer harm by licensed physical therapists trained in animal physical rehabilitation practicing physical therapy on animals. There are no examples of consumer harm in California or in any other state that regulates APR. The question is, the question then remains, if the board is seeking to occupy a scope of practice solely by licensed veterinarians when there are already qualified professionals safely practicing within that scope, and there are no examples of consumer harm by those practitioners, what is the purpose behind the regulation? It is surely not the protection of the public. Thank you for your time.
Next public comment comes from a Robin Roth. Your microphone has been unmuted. Robin, you are unmuted. Our last public comment comes from Karen Atlas. You will be given 1 minute.
Thank you. Thank you for hearing from me again. I just wanted to chime in this time about how this regulation affects me personally. This regulation directly and negatively affects my livelihood in a profound way. As well, it has a dramatic negative effects on all my clients. I am the owner of Atlas Rehab for Canines, a full-service, standalone, state-of-the-art rehab facility located in Santa Barbara. I employ 3 veterinarians, 1 PT, 1 LBT, and 6 assistants. Despite operating a clinic with 3 veterinarians on staff, this regulation would either require me to make a profound fee hike to accommodate the new ruling of direct veterinary supervision or require me to close my doors completely. Neither option is acceptable for me or my community of clients and patients. My rates would have to skyrocket with no added benefit by having a veterinarian watch me do the work that I'm trained to do. I've built trusted relationships. Built trusted relationships with my referring veterinarians, and we all work seamlessly together for the benefit of our mutual patients. I truly believe we are better together, so I ask for a unified approach to legislation and regulation rather than a segregated and hierarchical approach that is currently being proposed. Thank you.
Our next public comment comes from Chris Reed. You have 3 minutes. Your microphone is unmuted.
Thank you for your time today. My name is Chris Reed. I'm a doctor of physical therapy and the chair of the California Physical Therapy Association Government Affairs Committee. I speak in opposition to this proposed regulation. Animal physical rehabilitation is not established within the scope of practice of veterinary medicine. By promulgating the proposed regulations, the California Veterinary Medical Board is attempting to define and establish a practice within the scope of veterinary medicine when the legislature has not established it within California statute. Scope of practice of the licensed professions has always been held within the purview of the legislature. Animal physical rehabilitation should be established by legislative action, not by board regulation. I would like to understand why CVMB refuses to pursue a legislative resolution to this issue. Through this proposed regulation, it is clear the California Veterinary Medical Board believes only licensed veterinarians and registered veterinary technicians possess the knowledge and training to plan and supervise animal physical rehabilitation for animal patients to ensure proper animal handling, recognize pain and discomfort, and provide emergency care and assistance as needed in the particular field of animal physical rehabilitation. This is inaccurate because it does not consider the advanced training that physical therapists receive in animal physical rehabilitation, specifically during their animal rehabilitation certification coursework. The original stakeholders task force language was certain to include educational standards to achieve competency, allowing physical therapists to render safe rehabilitation services on animals while working under indirect veterinary supervision. Physical therapists are doctorally educated, licensed professionals trained to critically think and reason and to clinically assess patients who are both verbal and nonverbal. Physical therapists are accustomed to working in a collaborative manner as a team with other healthcare professionals. As a profession, we take our education and licensure seriously. We recognize our need for advanced training beyond what is provided in the physical therapy programs in order to be competent to treat animals. We are not proposing to work on animals without the necessary additional training. We are a licensed profession who takes on liability and responsibility for our actions, and we all carry liability malpractice insurance, and we have our own licensing board and practice act that we are required to adhere to. The California Physical Therapy Association urges the California Veterinary Medical Board to withdraw the current regulatory proposal and to seek an alternative solution which will specifically allow qualified and licensed physical therapists to work under the direct or indirect supervision of a veterinarian, with the level of supervision to be determined by the veterinarian. Further, that physical therapists are allowed to work on animals after a veterinarian has made a diagnosis and determined that physical rehabilitation would be a safe and medically necessary intervention for the animal patient. Thank you. I give back my time.
Next public comment comes from Robin Roth. Your microphone has been unmuted. Robin? Our next public comment comes from Ronald Moe. Your microphone has been unmuted.
Hi, thank you. I spoke earlier at the very beginning, so I'll just take an extra minute to add to my comment. I am opposed to this situation. I am a consumer, and again, if we can implement something like other states have, where they work in conjunction with a vet, this proposal would make it to where if I took my animal to a vet that did not have a physical therapist, my personal vet, then I have to go see another vet and pay additional costs in order that has a physical therapist. This is not correct, and this is not right. That makes it where I have to change my vet that I might have had for years and years, which I have a few vets for the many animals that I have. And I have my own personal physical therapist for my animals as well that I have chosen. So I'm opposed to this legislation or this situation. I want a choice. They should work together, but they should be referred by a vet that they need physical therapists, and they should be allowed to work separately from a vet because not all vets are qualified in this field of physical therapy. They should work together, but not in this way where vets control the situation. Thank you again for the additional 1 minute.
There are no more public comments. Would you like me to close this feature?
Yes, this is the president. Thank you, Madam Moderator. Please close the public comment, and then we are going to take a 20-minute break starting right now. So we'll be back at 11:30 to continue the meeting. Thank you.
Thank you.
Okay, it's 11:30. This is the president of the VMB, and I would like to go ahead and now turn this over to Justin Sotelo. Justin's with the Vet Med Board. Justin, are you able to go ahead and go through the written comments and the responses with us?
Yes, I am. I am. So let's see here. Should I be given access to control the what you see on my screen?
Yes.
This is the moderator, and you already have those privileges.
Okay, thank you. Okay, just bear with me. Okay, are you seeing that?
I don't see it. Does anyone? I'm not seeing it.
Okay.
This is the moderator. If you go down to the bottom of your screen to the share content button.
Yep.
You should be able to choose. There you go.
There we go. Okay. Thank you. Okay, so in the interest of time, I'm not going to summarize the kind of the detailed content in the memo, which kind of outlines the entire history of this topic as discussed and considered by the board, the MDC, and the task force. But just know that it is here under attachment 1. That's a more detailed listing and timeline of all the meetings where this topic has been discussed. So in attachment 1, I think you'll see a total of about 17 meetings where the topic of AR or APR was discussed. That does not include kind of the original meetings, I think in 2011, where discussions began. But just know that that detailed history is there, providing links to the meeting materials for each of those meetings and the minutes for each of those meetings as well. So I'm going to jump over to page 3 and get into the comments. Okay. So you'll see in the middle of page 3 kind of the breakdown of the comments that we received during the 45-day public comment period. That period was between March 13th and April 27th. We did receive a request for a public hearing on March 12th, which is the reason why we are having this hearing today. But you'll see here that we received 38 comments or letters in support of the proposal. All of those letters and comments can be seen in attachment 2. We received a total of 146 comments and letters in opposition to the proposal. Those are found in attachment 3. As referenced earlier, we also received a petition from the California Association of American Physical Therapists and Animal Physical Therapy Coalition in opposition to the proposal. And at the time of submittal on April 13th, that had been signed by 4,117 individuals. So that detail is also provided to you in attachment 4. There's also a link to the petition, which is online. And then finally, we received a separate comment or letter regarding a wildlife rehabilitation exemption. That's found in attachment 5, and we'll get into that in a little more detail once we go into the comments a bit more here. Okay. So just a brief summary of the comments and statements in support of the regulation. They're summarized here at the bottom of page 3 and at the top of page 4. But just briefly, it was argued by proponents that the emerging field of APR is under the practice of veterinary medicine, that APR should remain under the supervision of a veterinarian. It was stated that all 50 states allow veterinarians to perform APR without any additional certifications and without any restrictions. Individuals expressed that veterinary care should be directed by a veterinarian who is physically in the facility, determines who provides care, and can oversee the level of supervision, monitors patient response to prescribed treatment, and responds to medical emergencies should they arise. Proponents also argued that physical therapists working under the direct supervision of a veterinarian and in a hospital or clinic is in the best interest of consumer protection and patient safety. It was also argued that the proposal would not monopolize the market on animal health care, would not hinder interprofessional relationships and collaboration, and would not restrict consumer access to animal care professionals or APR services. Additionally, it was stated that the proposal retains provisions for the continued inclusion of licensed physical therapists. It stated that the proposal is reasonable, preserves animal safety, and has been through 3 different deliberative vetting processes, the board, the MDC, and the Animal Rehabilitation Task Force. So as I mentioned, all of those support statements can be found in attachment 2. We'll move on to the statements and comments in opposition. Again, we received a total of 146 individual comments and statements, and we categorized them into 6 different groups here. So you'll see here, number 1, opponents of the proposal. They argued that APR will be monopolized by the veterinary profession when some veterinarians do not even have time or the ability to provide APR services. Appropriately certified or licensed physical therapists will not be recognized as legitimate providers of APR services. Job opportunities for physical therapists will be reduced, and consumer access to qualified licensed animal care providers will be limited. Rural areas will continue to be underserved, and consumers will seek unregulated services. So underneath that, number 1, you'll see a proposed board response to that category of comments and statements. It stated that the board's proposal does not place additional limitations on existing law or restrict consumer access to APR services. Rather, the proposal clarifies the authorized practice of APR by physical therapists under the direct supervision of a licensed veterinarian. In this way, the rulemaking establishes the ability of physical therapists to practice APR on animals. Otherwise, physical therapists are only authorized to practice on humans by the Physical Therapy Board of California. The next category of comments and statements were entitled or kind of characterized as Apr Competency, which we've heard a bit about today. Opponents are stating that the proposal does not ensure educational competency of practitioners, and that a true provision of consumer protection would include mandatory educational standards for all who practice AR. It was stated that the specialty of AR or APR is not currently taught and tested for in a veterinary or veterinary technician schools. The proposed regulation is asserting that a veterinarian is more knowledgeable and experienced in rehabilitation than an appropriately certified or licensed physical therapist. Okay. So beneath that, you'll see the board's proposed response to that category of comments and statements. You'll see here, I'm not going to go into detail, but we define or state what the definition of the practice of veterinary medicine is. That's in the first paragraph. The second paragraph, hold on, maybe. I'll just note that last sentence in the first paragraph. It says the board's APR proposed regulation would authorize non-veterinarians to perform APR under the supervision of a veterinarian. The board's proposed regulation does not go beyond what is already prohibited by statute. And then I'll just read that last paragraph there. The board does not have statutory authority to create a new license type or certificate for physical therapists that potentially would establish educational standards for obtaining that license. To provide increased consumer access to APR, the board is establishing the ability for physical therapists to provide APR under the supervision of a veterinarian. The board's proposal is the only law that would allow physical therapists who are licensed under the Physical Therapy Practice Act to practice APR. And please stop me along the way if you have any questions or if you need me to clarify anything. The third category of comments and statements pertains to scope of practice. And as it's been mentioned earlier, stating that APR is not currently established in statute. Opponents argue that APR is not established within the scope of practice of veterinary medicine, and the proposal attempts to define APR in regulation without legislative authorization, input, or oversight. APR should be established by legislative action, not by regulation. And here we just refer you back to our response under item 2, where we discuss the definition of the practice of veterinary medicine. Item number 4 is categorized as alternatives or the task force recommendation that has been mentioned today. Opponents stated that legitimate alternatives to the proposed regulation have not been considered. The task force had recommended an indirect supervision model that would have allowed licensed therapists with certification in AR to practice on their own premises under veterinarian direction, but not require that a veterinarian be on site or be their direct employer. And the proposed response for that for board consideration is as follows. The task force recommended the creation of a board-issued APR certificate for California licensed physical therapists. However, the board does not have the authority to create certifications through regulations. This would require statutory authority granted by the legislature. Since the board does not have the authority to create certifications, the board's proposed regulation does not include the creation of an APR certification. We've heard a bit about what other states are doing, and Assembly Bill 3013. Opponents argue that other states, Nevada, Utah, Colorado, and Oregon, have established APR in statute and created successful models providing for collaboration between licensed groups that benefits the pet owning public. The board should follow in the footsteps of these states. Opponents also stated that AB 3013 was a logical legislative solution in California that would have properly included physical therapists. However, the board had an inflated cost estimate. The proposed response for that is again referring to our response under item 2, and that the board does not have statutory authority to create a new APR certification. Category number 6 has to do with a human medical or physical therapy model. It was stated by opponents that the human medical model works well and does not require that a primary care physician be on location with a physical therapist. Indirect supervision is a reasonable option for veterinary patients as well. Providing a VCPR is established. Direct supervision or having a veterinarian on premise is an unnecessary barrier. And you'll see the proposed response for that category of comments and statements. The board does not have statutory authority to create a new license type or certificate for physical therapists that would potentially establish educational experience and safety standards for obtaining that license. To provide increased consumer access to APR, the board is establishing the ability for physical therapists to provide APR under the supervision of a veterinarian. The board's regulatory proposal is the only law that would allow physical therapists who are licensed under the Physical Therapy Practice Act to practice APR. Further, the human medical model does not apply easily to treatment of animals, as animals are unable to converse about their treatment plan or effectively communicate pain or discomfort from treatment. Providing APR under indirect supervision and without the presence of a licensed veterinarian places the animal patient in potential danger if the physical therapist is not well versed in complications and side effects of APR for the specific animal patient. Okay, so those were the 6 categories and proposed responses to those categories of statements for the board's consideration today. You'll also see here some information regarding the petition received. I'm not going to go into the detail that's provided here, but just know that this section was in response to statements made in the petition. So those statements are identified in italicized text and where we felt like a correction to the statement needed to be made. So I'm not going to read through all of these, but just know that the italicized text is the statement from the petition, and beneath that is the board's correction to that statement. So I'm going to get into the substantive comments provided in the petition. And again, the petition at the time of submittal on April 13th was signed by over 4,000 individuals. And you'll see kind of similar categories that you saw above here. So in this section, I think that we have 4 categories. Category 1, again, discusses APR being monopolized by the veterinary profession, physical therapists not being recognized, that there will be reduced job opportunities for physical therapists, and limited access to quality animal care. So the proposed response to that is going to be similar to what you saw above. Okay. And then again, as you saw above, there was a category of APR competency. The petition stated that most veterinarians do not have the knowledge or skill set to provide physical rehabilitation services. Veterinarians are no more qualified than human physicians to perform rehabilitation on their patients. APR requires highly trained, qualified, and skilled physical therapists who are the best possible providers of this specialized service. And again, our response is going to be similar to what you saw above, where we cite the definition of the practice of veterinary medicine in statute. And so I won't read that in detail because a lot of this text is very similar to what is stated above. And again, we had an alternatives category. The petition stated that physical therapists who have additional training in AR should be allowed to work under the indirect supervision of a veterinarian as long as a referral is made. And again, you're going to see similar language to what was stated above. The board does not have statutory authority to create a new license type or certificate for physical therapists that would potentially establish educational experience and safety standards for obtaining that license. To provide increased consumer access to APR, the board is establishing the ability for physical therapists to provide APR under the supervision of a veterinarian. The board's proposal is the only law that would allow physical therapists who are licensed under the Physical Therapy Practice Act to practice APR. And again, similar language to what's provided above. The human medical model does not apply easily to the treatment of animals, as animals are unable to converse about their treatment plan or effectively communicate pain or discomfort from treatment. Providing APR under indirect supervision and without the presence of a licensed veterinarian places the animal patient in potential danger if the physical therapist is not well versed in complications and side effects of APR for the specific animal patient. And again, a reference, category 4, to what other states are doing or have done, and the bill AB 3013. The petition stated that the model of indirect supervision has been in successful practice in many other states for years, and that legislation consistent with AB 3013 should be passed. And again, we're referencing our response under item 2, and again, stating that the board does not have statutory authority to create a new APR certification as proposed in AB 3013. Okay. So that concludes the opposition. At the end here, there was a separate comment or statement made regarding wildlife rehabilitation, and that is provided in detail under attachment 5. But I'll just read it because we do need the board's input for a proposed response to this statement. That's why you don't see a statement there, but I'll just read it here quickly. One individual submitted correspondence to the board that wildlife rehabilitation remains a point of confusion. It is a very active field in this state, and nearly 100,000 animals go through the hands of wildlife rehabilitators each year under permits from CDFW and the USFWS. The individual noted that there is nothing in the board's rules that exempts these animals from falling under the proposed physical rehabilitation rules. The individual asked that the following text be considered for inclusion in the proposed rulemaking language. And that reads, this regulation does not apply to wild animals being rehabilitated under permits from CDFW and USFWS. The commenter further explained that wildlife in rehabilitation need physical therapy all of the time prior to release, and neither domestic animal veterinarians nor RVTs are trained to do that. So this is where we would need some input from the board. Okay, let's see here. So I've been receiving additional written comments during the course of the meeting, and I had a running tally, but if you guys give me a moment and just a few minutes, I can provide you with an update in terms of how many additional written statements in support and in opposition we've received during during the hearing. So let's see, I think I will state though that in reviewing the letters of opposition received during the hearing, I've been screening them. I haven't seen any new arguments made. So I think the responses that we provided in this memo would still apply to many of the statements and arguments that I've seen. However, if after the conclusion of this hearing, we do see anything different, any new arguments made, we will be sure to get the board's input on those arguments. So Jessica, please remind me. I want to make sure I'm not forgetting anything here. I'm getting to the end.
The only thing I wanted to add, members, and for clarification for those participating from the public, we did receive quite a bit of additional comments up until a little after 3 yesterday. We compiled all those comments, sent them over to the board members. We also sent them over to our internet team to get those posted. They should be posted by close of business tomorrow. In addition, at 4:20 yesterday evening, we received substantive arguments from CMIS Associates, and we did not have time to prepare a response for those, and so we will have to take any substantive comments that are not properly responded to today and consider them in the October meeting.
Okay, thanks.
So I think that thank you very much, Justin and Jessica, for that clarification. So I would like to now turn to the board members, and we're at the stage where we need to consider adopting, either changing or adopting as is, the proposed responses that we have generated so far in this issue. I have a hand up by Cheryl.
I move to approve the proposed responses provided in the meeting materials memo for inclusion in the final statement of reasons with the exclusion of wildlife rehab.
I'll second that.
Okay, and I have Dr. Bradbury seconding that. I would like, so I'm going to explain what's going to happen here. So I'd like to have an opportunity for board members to make comments. And then I would like to, at that point, have our moderator open it up for comments related specifically to the proposed response that we have considered, that we are considering it before us. So having said that, I would like to open it up for board member comments at this time or questions.
This is Kathy. Is it okay to, I put it, okay. I agree, and I think the responses are very well written. I would suggest one potential change and just for consideration, in the paragraph that's in several of them where it talks about further the human medical model does not apply easily to the treatment of animals, as animals are unable to converse in their treatment or effectively communicate pain or discomfort from treatment. I was going to suggest adding from or during treatment, because I think part of the discussion here is other things going on with the animal that would not be perhaps apparent, and an individual might not know, and they can't say, by the way, they can't say it. So I thought it's not always from treatment. It could be something else going on with the animal during treatment. But I just wanted to give that for consideration.
Okay, great. Mark, do you have any comments?
Yeah, I wonder, since all the comments in opposition have been categorized into 6 opposition points, if it might be helpful to just take each opposition point one by one and have the board members comment on them that way before we move to adopt all 6 responses. That's just a thought.
Well, does that mean you have substantive changes for all of them, Mark, or is there a particular one that you are interested in changing?
No, not in particular. I just want, I mean, I agree with the responses. but I just wanted the public to have an opportunity to respond to the responses and have us justify our responses in that way. But at this point, there's no specific changes I have to any of the responses.
Well, and I would think that probably the public will have a chance to respond to any of those as they see fit. So
the only question I have is, like Jessica Seefingham was saying, I'm not exactly sure what is included in that package we got at 4:30 yesterday, the one that we're going to have to deal with in October. And I think it's referring to scope of practices being defined by legislatures and not anybody else. I don't think we have the opportunity to discuss that here, but that's my only question at this point.
Well, and that's the beauty of being able to discuss it in October when our staff has a chance to draft a response and we have a chance to kind of digest it, I think. I also feel like there were some questions brought up from the livestock standpoint. I know the wildlife was a written comment, but there are some issues in large animal medicine that probably need to be thought about and addressed as well. I was going to bring that up. And I think those were substantive enough that we need to address those in October as well. But having said that, Alana, do you have any comments?
In terms of excluding wildlife?
No, in terms of the proposed wording for the responses that we have here, and if you have any other things you're concerned about us not having the ability to address today.
Well, I just am concerned about the costs. You know, if a veterinarian has to have direct supervision, and maybe I just need some clarity here too, that means that a veterinarian would actually have to watch a physical therapist do the physical therapy. Is that what this proposed change would be?
No, Cheryl, go ahead. You're shaking your head.
So no, they just need direct supervision. So that's not the definition of direct supervision. So the way we've defined, or the way it's written, is direct supervision is just the veterinarian needs to be available in the building, and as far as small animal medicine. So no, they don't have to stand there and watch it.
And so a lot of these facilities actually have veterinarians on site. So are they not, I'm sorry, I'm getting messages. Are they not in alignment with the law as it stands, or if we pass this, would they still be in alignment with the policy?
If there's a veterinarian in the building, they're fine. Then they meet the legalities.
Christina?
Okay.
And I think, and correct me if I'm wrong, that currently, without this regulation, they are not legally operating, and they are violating their own Practice Act of physical therapy. So currently, the way it stands, by them doing this and providing treatment and care to these animals, they are in violation of their own Practice Act and not following the law as it is. So this would allow them to do it legally. That's my understanding of what we're doing.
Tara, you're leaning forward. Does that mean you want to speak? Okay. Jennifer Laredo, do you have some comments you'd like to make or questions?
Yeah, first off, I want to thank Justin for going through that very detailed explanation. I know this thing has been going on for 9 years, which predates all of us with this board. And since the last time we had voted on this language, there hasn't been a lot that's changed. I don't see any new certifications. The one thing that did concern me from all of the comments today was the gentleman who spoke from the Equine Center. And I do remember, Dr. Nolan, you had a concern with that as well. I remember the definition of basically cold hosing a leg could have possibly fallen under. So I do agree that we need to define the large animal versus small animal, but I still believe a lot of people are saying that it's a monopoly and that it's this. I don't understand why there's so many groups that take offense to trying to regulate the practice of veterinary medicine to veterinarians. I know when I used to take my dog to the doggy chiropractor and acupuncturist, my husband would always ask if she could put needles in his foot. He wasn't joking. And she said, no, I'm a veterinarian. I practice on animals. So I still struggle to see the difference in this. So I appreciate all of the comments today, but my main concern was the large animal versus small animal and the wildlife as well.
I got a question. Why would we exempt equine?
I don't know if it's exempting equine. It's just that the equine world is set up because of the size of the facility and that veterinary clinics don't usually have that kind of facility, and so they work in conjunction with either trainers or animal rehabilitation specialists. It's similar to what happens on the racetrack. You have a horse on the racetrack. The horse ends up with some physical disabilities, some injuries, something like that, and you send the horse away from the racetrack to be dealt with somewhere else. And so it's very hard to have a veterinarian on site at those facilities and also practicing medicine. Does that make sense? So it seems a little more clear that it's hard to have both of those facilities in the same place. It would take a tremendous amount of probably infrastructure to deal with that at this point in the industry. So I think it's not trying to take away supervision of a veterinarian. It's trying to define that supervision by, how do we know the veterinarian is responsible so that if something happens to that horse at a facility where he, let's say, is on a hot walker, 3 times a week, how do we know that veterinarian still has oversight so that he or she can be disciplined or corrected? Does that make sense? I think Alana, you're muted. Yes, sorry.
It seems that equine shouldn't be exempt for the same exact reasons why we're saying the veterinarian shouldn't, or for companion animals as well. It's like we need to make sure that the PT is doing, safe practice on an animal, and that the animal is medically capable of taking on that PT, right? So why would we do anything different just because size? I mean, and I understand the horses are large, they are in fields, they're in, stables and whatnot, but it seems like we should not exempt them.
Cheryl, your hand's up.
So again, it's been a couple years since we went through all this, but I believe we did something. So Jessica, can you find that? I think didn't we have some specific language for in the large animal setting or the field setting, or however we put that?
I don't have that readily available, but I think Tara might. She's raising her hand.
Yeah, it's in the packet. Oh, wait. Well, actually, I'm looking at what the board has posted online for the animal physical rehabilitation, the proposed language. It's in proposed section 2038.5, subsection D. It says, if at the time the veterinary assistant is performing APR on an animal patient in a range setting, the supervising veterinarian shall be in the general vicinity of the treatment area. So it's not in the building, it's in the area. That's how we were trying to incorporate equine practice.
Christina, you have your hands up, and then Kathy.
I saw Alana looking still a little puzzled. Most equine vets don't have a standing practice. A lot
right,
of them,
they travel from farm to farm or track to track.
So I think with that wording, it means that the veterinarian that's supervising should be probably the person that's in the area and available to come, or the person that has the is doing the physical therapy is able to call a veterinarian to come in a timely fashion is, I think, I would guess what the intention of the wording is, so that they really are, around, and that's kind of as close to in the building as you can be when you don't have a building. Maybe that's
Well, why can't we have that same rule for this? I mean, if they can call a vet, or if they are just within a few blocks of a veterinarian, why do they? I mean, I don't understand why they would have to be any different from horses.
So I'll jump in and explain where that came from. If a veterinarian goes to a stable or barn, and let's say it's got 60 horses in it, and that veterinarian has an assistant with them, whether it's a physical therapist or a chiropractor or a RVT or even a veterinary assistant, they'll be working on one horse. He'll say, I want you to cold water wash that horse for 20 minutes, and then I want to ultrasound that leg or something like that. Then he's going to go over to the next side of the barn or over to the arena to watch another horse move. And so there is no building really to hold them in, to be in that building. So we were trying to establish the building as the general area where that vet and his team or her team are working. Does that make sense? Because that
makes sense, but I just don't see why it should be any different. I mean, I think if they're a phone call away, if you're on one end of the property and, on the other end of a few acres away is another facility for the horses. I mean, it's like, it could be the same for the.
Yeah, don't forget horse owners and pet owner, any pet owner. If a veterinarian says, I want you to do this treatment to your animal and I can show you how to do it, then they're allowed to do anything they want to their animals, right? And most horse owners are given, the veterinarian comes out, diagnoses, and gives a plan to the owner of the horse, and the owner usually does a lot of the treatment. But we were trying to address a mobile practice in which a veterinarian has a team with him that's not the owners of the horse, but that is trying to get treatment established while they're at a certain facility. And it's not their facility, and it may not be the owner of the horse doing it. So we're trying to make that legal without saying you have to be inside a building, because the definition of direct supervision is within the building, and there's no building there. So that's why we said the range area, the general area. So it's really not addressing it's not addressing the issue that was brought up today of actual rehabilitation centers that are operating as rehabilitation centers for horses that don't have owners present, that don't have veterinarians present. We're not addressing that here. The regulatory wording does not address that at all. It's just trying to define what's meant by the area where the veterinarian is practicing, the physical area. Does that make sense, Alana? So the questions that were brought up today by the two equine veterinarians, we haven't addressed with the regulation, not with the wording of today.
Well, it just seems that these physical therapy centers could easily call a doctor down the street, similar to what's happening in the horse world. I just don't think they should be exempt, because I know these equine people were asking for exemptions. I mean, if we're giving them exemptions, I think we should have the same exemptions for companion animal.
Okay, well, that makes complete sense, but I think the wording Tara read is not meant to give them exemption. It's meant to define what an equine practitioner faces on a day-to-day basis as a locality, because they're ranches usually and farms, and they're not. So
I understand that, but I feel like in terms of physical distance, like if a rehab facility located in an urban area, there's multiple veterinarians down the street. I mean, there's usually tons of veterinarians in the city, multiple, and they're probably not that far away. So I just don't understand why we still need direct supervision over these physical therapists when these people are trained and they've gone through extensive schooling and education. And I mean, I just don't, especially, I mean, are you guys taught physical therapy in veterinary school?
Okay, thank you. Cheryl?
So when they say the veterinarians that there's no physical therapy or there's no physical rehabilitation taught in schools currently, that is wrong. UC Davis has a whole department in it, so I don't know where they're getting that claim. So Alana, I know you weren't here when we went through all this, but believe me, we have years and years of going through this. So let me kind of just fill you in more here. So these so-called courses that they've taken, or all this education that they have. So in physical therapy school, they're taught humans only, no animals at all. These courses that they're talking about are more like a workshop. There's no accredited school. There's no licensing exam. They take these workshops. It's 120 hours plus some online courses. And then they take a collaborative exam at the end of it. It's not even a one-on exam, or personally, at least with CRI. It's a collaborative exam that they do together. So nobody fails. Everybody passes. And there's, so there's, they're not accredited. They're not licensed for this. So they're not, when they say that they have all this education, they don't. Their education is great for humans. They do a great job on humans. But this education that they're claiming is not something that we could, as a board, okay as being, and that's part of the reason for the claim that we increase the amount of cost for the appropriations, because we're trying to put something in there for certification. Because we can't just, anybody can take a course and then they're an expert in this. That's not true. So we're trying to include something for certification. Plus, a big problem is that if we can't, as a board, discipline physical therapists, we can only discipline veterinarians and RVTs and VACSP holders. So only people that have a license or a permit through us can we discipline. So if anything goes wrong at a facility where a PT is in charge, there's no veterinarian, we cannot, and they do something horrible, we cannot discipline them. And not only that, but the physical board can't discipline them either.
Have we had complaints come to our board of a physical therapist harming an animal ever?
We checked it at the time we were going through this. They don't label them so that we can go back and even check.
Jessica, has the board had any complaints about, I know you say you can't check, but I mean, recently, since you've been our director, have you had any complaints of physical therapists harming animals?
So like Dr. Waterhouse has said, we don't categorize those as that far of a level. And I think even in some of the materials that we provided for Agenda Item 3, we explained that things are categorized as unprofessional conduct or incompetence or unlicensed practice. And so we're not, the data doesn't break it down to physical therapists. And as you know, we receive 1,300 complaints a year. And so it would take an extremely long amount of time to go through each one to determine that level of detail.
I think Kathy was going to say something.
Thanks. Just a couple of things. And since I've been on since 2014, I did attend the hearings, the MDC hearings on the physical therapy, and of course we've had it through all our board meetings and read all the materials. I'm glad we're talking about the equine thing, and I'm glad Tara addressed it, because I do recall a lot of discussion, and it wasn't about creating any kind of an exemption. It was more about understanding the environment, because small animal and large animal are totally different in terms of settings. So I'm glad Tara directed us to where that was, because when I read some of the equine comments, I thought, didn't we somewhat address this? Which I think we did. I do think that the discussions that we've had over the many years on this, on all sides of the equation, show that there is, well, I was in favor of the vote before, when we voted to create these regs as they stand now. And I haven't seen a lot to change my mind in moving forward on these. I do think, maybe tweaking the responses a little bit and addressing the wildlife. And I want to clarify on the equine thing, just to make sure we're not missing something in these, in the discussion here on equine animal rehab and equine rehab. So I just wanted to make sure we're covering that, but I'm glad Tara brought it up about where it was because it was driving me crazy. I knew we had talked about range settings a lot, and I just couldn't remember where it went.
And members, so you know, I am sharing the screen right now and showing the language, and I've highlighted where that is in the language.
I apologize to the board members. I have a hard time knowing who wants to talk and who doesn't. So Alana, are you done talking or do you have more to say? And then I think Cheryl had her hand up.
So again, another part of trying to catch Alana up to speed here. So a couple years ago, when we were going through all this, I went down and visited one of the hospitals in LA that just does APR. And they have veterinarians and physical therapists working together. And I sat there and first of all, about at least 90% of the dogs were geriatric with multiple problems. So I think that's their normal patient load. And I observed the veterinarians, I observed the physical therapists, sit down and talk to them. And the physical therapists were great people. But what I noticed was several times the physical therapist would go ask the veterinarian something. What do you think about this? What do you think about that? Look at this. And then another time I was with the physical therapist and she was working on a dog and it was standing there with its elbows out. And she was telling me that the dog had, a certain problem and why it stood that way. And then she also was telling me that this dog was recently diagnosed with one of the emergency clinics with a severe immune-mediated disease, and it was on high doses of pred. So I'm like, oh my God, and this is a very elderly dog. And I'm like, they also stand that way when they're in heart failure. And she goes, really? And she's worked with a veterinarian how long? And she didn't know that dogs will stand that way when they're in heart failure. So it's just an example, a specific case of why veterinarians need to be why physical therapists need to work under direct supervision.
This is the moderator. Dr. Nunez and Jennifer Laredo both have their hands raised as well.
Glad she can see it. Okay, Dr. Nunez, if you want to go first and then Jennifer. And where do I find that?
I thought you could see that.
I don't know how to raise my. Oh, I see it. Okay.
Okay. I thought you were ignoring me, Jamie, but now that you.
I would never do that. I'm not sure where I can't find the hand thing today.
So just two things that I want to address. One is the Alana had asked about have there been any reports of physical therapists harming animals? It goes back to the question of recourse. Jason Kaiser of the Physical Therapy Board had mentioned that if there ever is a complaint about a human PT causing harm to an animal that goes to the Physical Therapy Board, they'll dismiss it as non-jurisdictional. So I heard that, somebody made the statement that there's been no documentation of harm being done to an animal by a human PT. Maybe because there's no recourse. If a human PT does harm to an animal, where is the recourse? It does have the potential of going to our board, and our board would probably classify that as unlicensed activity, and it still, though, is a matter of jurisdiction, because even if it is unlicensed activity, they're not under our authority to regulate them doing business. So although we can perhaps do a citation or something like that, we can't pull their license to practice physical therapy because we don't have authority to open their license. So that the proposed regulations that are in front of us does address the issue of recourse sufficiently, because even though the physical therapist might not like the role that they've been established to as that of being a veterinary assistant. And I know that that is a demotion, and I get that, and it may not be a deserved demotion because they are well trained, but by being under the direct supervision of the veterinarian still ultimately is the person that is going to get recourse or discipline if something goes wrong with that. The other point I was going to make was in regards to the exemption for equine medicine. The point that Cheryl had a recollection of, and the point that Tara clarified, was came up during the task force when we were exploring the path of supervision, direct supervision, indirect supervision, and so forth. And that's not necessarily language that made it into the actual proposed regulation, but we were saying that in a range situation like equine practice, it's not feasible for direct supervision to be in the same building. So they were going to allow indirect supervision in a range setting just because of the logistics of it. There's one more point I was going to make. I forgot what it was. Oh, I remember. The exemption for equines is somewhat addressed, though, in the regulations that's in front of us, where it says 2038.5, section A2, that physical rehabilitation does not include relaxation, recreation, or wellness modalities, including but not limited to massage. And then athletic training, I think, is a really, really big and unique part of the, especially the horse racing world, because the horse racing stakeholders were definitely interested in what the task force was talking about, because I think equine medicine is pretty unique in that they have actual athletes in their field there that may not be applicable to the rehabilitation rules that we're setting today. That's what I would say. Can you see my hand now, Jamie?
Yes, yes, I'm so excited, and I don't
lower my hand now.
I don't see Jennifer's hand. Did you have your hand up, Jennifer? I thought the moderator mentioned you.
I did, but then when you called on me, I put it back down.
Okay, so I see Christina and Kathy. So Christina?
No, I'm still talking to me. Sorry, Jennifer.
Oh, no, I'm sorry. Jennifer wants
to
talk.
So my comment is a little bit late after this. Mark pretty much addressed it, but to answer Alana's question, the exemption for equine wasn't really an exemption. It was definitions, and it came way back to, we had a meeting years ago. It could have been Fresno, I don't know. And we had several stakeholders from the equine industry come and testify about how they have assistants who handle the horses, and they are the best at handling. It's a safety issue. Horses carry, I don't know how many thousand pounds of pressure per square inch when they kick. And the way that it was intended to be written would have excluded them from being able to do that because they were not licensed. So it was more of a clarity thing than an exemption. Now I'm done.
Okay. So now we have Dr. Bradbury and then Ms. Bowler.
All right. So I guess we were kind of talking about, it sounds like more than just whether to adopt these things. But I guess on just the other hand, with what Alana was saying about an exemption, and if we needed to talk about it more, I don't know that we do need to talk about it more. And I understand the concerns, but I got to thinking about these facilities, like the gentleman who testified, who I thought was very, very good, and the boarded equine practitioner who's in sports medicine and rehabilitation. And I kind of understand what they're saying, but I guess I just wonder why they can't just hire a veterinarian to be at the facility. They make a lot of money doing that, and there, I don't think anybody would question that. And so,
thank you. I didn't understand. That was my same exact thought.
So I guess I don't understand why, and it may actually increase the amount of veterinarians being trained with physical therapy and becoming boarded, because there would be more of a market for them if people were actually utilizing them and being, required to have that as part of the direct team. So that was just a thought I had as I was kind of working through this in my mind. I think that's very different, though, than a mobile vet that's coming out to say where my horse is, and they are like, we want to do this, and it's a very different kind of a scenario. So anyway, that was just my thoughts there. Overall, I just there's this whole notion. I just want to say these things, I guess, since this is our chance. This notion that we are here to protect the veterinarians, and that this is all a conspiracy to, maintain their ability to make more money, and that it's a monopoly, is I'm stunned by it, because the majority of the people that are talking are the ones that are actually worried about losing their own money. Like, it's all about their money that they're concerned about. And they've brought that up on multiple occasions, yet they're accusing us of, trying to have a money grab for veterinarians. We are not here to protect veterinarians. We're here to protect the public and the animals. And a lot of their arguments just are not even founded in anything we can do, about how we can we should be certifying them and regulating them, and we can't. That's the problem. That's the biggest problem here. And so it's frustrating that we have to keep going over this as a board, when it's clear that there's a number of people, a large group of people, who are really, violating their own practice act with what they're licensed under, not adhering to their own rules, and then we're supposed to trust them in following rules that we may set in the future under legislation. So I find that stunning, frankly. I think that the notion that we're not trained in physical therapy, I think there's some truth to that in a lot of vet practices and younger veterinarians. But I had 2 weeks in a physical therapy rotation when I was going through school, and then in my internship, there was a physical therapy program that I went through. And I'm an internal medicine specialist. I'm not even involved in this stuff. So I had training, but I can tell you that I would refer to a physical therapist, physical therapy group, and I refer to UC Davis now. But it's not that we don't think physical therapists bring something to the table. I absolutely do. I think that their argument that they have this doctorate in physical therapy, I think that that's amazing. And I researched all of that before this meeting, because I really felt like I didn't understand the field, and I was really impressed with what the physical therapists do have to learn. But it is really 100% human anatomy, human physiology, even the pain control and pharmacology. That is very different. Animals have a different means of locomotion, different centers of gravity. There are different animals. There's different breeds of animals. I mean, a Pekingese is very different than a German Shepherd, which is very different than a cat, which is very different than a horse. And a few weeks of training in a program is great that they're getting that, and I think that it has its place. But I'm stunned that there's a group of people that are basically not following the law right now, and are upset that we're just making a regulation that allows them now to do what they're already doing. But it just means that they have to have a veterinarian directly involved. And I just don't think consumers understand. I think there's been a lot of misrepresentations and a lot of misunderstandings. And I don't think that they understand that if they're physical therapists, while most of them are probably great and honorable people, just like in any field, there are going to be those that are not. And those people, there's no recourse for you, consumers. There's nothing you can do right now. There's nothing that will happen. There's no board for you to complain to. And how is that protecting you? So I felt like I had to say that since we're here. And that's, I would like to approve these as soon as we can. So that's my thoughts on things. For giving me that time.
Okay, thank you.
Are
Kathy.
we voting on this? Are we voting on this today?
What we're voting on is simply the wording that is in response to the written comments that were made in opposition. So that was the wording that Justin presented to us.
Yeah.
We are voting on that. What we are doing is we're going to have to revisit this in October because there were some substantive comments made late last night that we haven't had a chance to formulate an opinion on. It came in almost at 5 o'clock last night. So, but today we're trying to actually discuss and approve the responses that Justin shared with us.
Okay.
Does that make sense? Okay.
And I would add that the regulations have already been voted and approved. So that's not what we're voting on. The regulations as written have already been voted and approved.
We're pretty far down the path of getting them approved. This was the public hearing portion. But I don't want to lose Kathy. Kathy had her hand up for a long time.
Well, actually, Christina started it because I was trying to get back to where we were voting on. I think it's important, though. I think there's been a lot on the record from all the various board meetings that we've had regarding this, but I think it's important to get everybody's concerns on the record. I know we're not relitigating these. We are just dealing with the board responses. And I'd reiterate my slight amendment to that one piece of language as a recommendation. But again, I think, and Christina covered a lot of what I'm saying. As a consumer, I am concerned, and I feel like I think the alternative that they provide, that they discuss, seems reasonable, except that, a VCPR is a 1-year established under our act, and indirect is not there, and there's so many potential underlying conditions that may need to be addressed that I really feel. And I have to say, in terms of access, now that I can't speak for all of the state, but I've used a number of animal rehab vets in this Sacramento region, and not just UC Davis. There are practitioners. I wish, again, there were more cardio veterinarians, specialists around, because I think Dr. Klingborg mentioned a stat, which I thought was pretty astounding, about the number of certified animal rehab vets versus cardio, and I can't remember the other ones he mentioned. And it is true. There are, in other fields, and possibly ophthalmologists as well, a lot more limitations in where you can find a specialist than there are in this field. So anyway, that's just what I was going to say, and then just decide where we were at the question in hand here on the responses, because I think that's what we want to consider and make sure that the board responses are correct as we have right now. I know we have more materials to consider and more response to deal with in October, but to make sure that whatever we do today is well vetted amongst the board members in terms of making sure it reflects what we mean.
So on that note, Jennifer, I would like to ask if you can have Justin pull up the wording changes that Kathy is asking for. Can we do that and just make it very clear what she's asking? I think it was in the first response. Was it, Kathy, can you clarify that?
The first time it appears, I believe, because I marked it, is in, well, I know it appears in 6, the human medical physical therapy model, but I think it appears elsewhere as well. Oh, I know it appears. So in 6, it's the second paragraph. beginning with further the human medical model.
We're going to give Justin a moment to find that spot. Justin, do you need help or do you understand what she's talking about?
I mean, there may be other folks with other changes, word changes as well, so I don't want to.
So let's deal with them one at a time here. Let's start with yours. And for the record, I think that's a good change, Kathy. I thought that was a good catch.
Thanks.
This is Tara. Justin? Yeah, we can't hear you. I think you're muted, but I was going to tell you that it's on page 6, item 6. Under the proposed response, it starts with further the human medicine model. And then Kathy, can you read us your tweak to that paragraph?
Yes. So it's the first sentence of the second paragraph. And the third line where it says effectively communicate pain or discomfort from or during treatment would be my addition.
And I believe that we refer to that several times, don't we, in this? So we need to correct it at each location.
Yeah, so we'll notate it. It looks like we might not be able to edit the document right now live, but we'll make a note to include that in every iteration of it.
Okay, so we have one proposed change to the wording, to the responses. Is there anyone else that has any proposed changes to the wording of these responses? I see, Christina, you have your hand up. Is that old or new?
Old. Oh, it's old. Sorry. I think I've said enough. Thank you.
Okay. So we have at this point a motion that we might need to amend. Cheryl, do you want to amend it to accept Kathy's changes?
I will accept that amendment, and I think and I have no little hand signal or hand symbol.
It's down at the very far right hand. If you open up the
It's not there. It's all blank. My right hand side is all blank. There's nothing there. It's nothing like before. So anyway, I will accept that amendment. And can we also, in the section where the opposing people say that veterinarians have no education in this, say that, counter that with, UC Davis has a whole department on APR.
Okay. So the motion now has the proposed to accept the proposed response wording with the addition of Kathy Bowler's amendment and Cheryl's amendment. Any questions? Any more questions from the board? Again, I'm looking at hands, but also faces. Mark, you have your hand up, but you're muted.
What number opposition is Cheryl's point? Is it 1, 2? Oh, competency? Okay, that's my question.
You were the seconder of this motion. Are you willing to accept the changes as we've discussed?
I was, yes.
I'm sorry, Christina was. Okay. So we have a motion and a second. Any further discussion before we open it up to public comment? Okay, seeing none, then I would like to ask the moderator to open up for public comment specifically regarding the proposed wording of responses to the statements of opposition.
This is the moderator, and I have, at the direction of the board, opened the Q&A panel. If you would like to make a public comment in regards to the topic at hand, please click on the Q&A icon at the bottom of your screen and type "I would like to make a public comment" in the Ask field and send to all panelists. I will take comments in the order they are received. I will now pause a moment to allow individuals time to access this feature. We have received no request for public. I take that back. An individual identified as Francisco would like to make a public comment. You have 3 minutes. Your microphone is unmuted.
Hear me? Hi, can you guys hear me? Okay, perfect. I would just would like some clarification from the board. You guys have argued on your responses that you can't regulate any sort of APR certification through regulation, only through legislature changes. However, you guys also argued the opposite when it came to the definition of physical therapy being included in the Veterinary Practice Act in California, that something would only be able to do, something could be done through regulation, but not through legislature. So it just seems a little bit contradictory. So I just wanted to ask if you guys could clarify that for us. Thank you.
An individual identified as Elizabeth Reed, your microphone is unmuted. Elizabeth Reed, your microphone is unmuted. An individual identified as GV Ers is our next public comment. Your microphone is unmuted.
This is GV Ayers, and just want to make a comment on the written comments and the adoption of them. I thought they were lacking in several areas because, in particular, some of the comments that I had submitted earlier, your written responses or the draft written responses don't address the idea of that the proposed regulation will have significant adverse economic impact upon businesses and jobs, which we commented upon. And also the dangers cited by the board are not based upon fact in the relating to the initial statement of reasons and the economic impact analysis. There was no comment on that, and that the legitimate alternatives are not considered. That we had a comment on that as well. And then also that the expertise of physical therapists qualified in animal rehabilitation are ignored. And then also that the regulations do not place protection of the public as the board's highest priority. Those are the things that we wanted to point out as far as some of the shortfalls of the draft written comments.
Our next public comment comes from Karen Atlas. Your microphone is unmuted.
Oh, thank you so much for hearing from me again. I just wanted to make some comments and clarifications on some of the statements that were made in response to some of the questions that were brought up. Trying to separate out species really doesn't make any sense for veterinary medicine. If you're going to say that it's too dangerous to treat a dog without direct veterinary supervision, and then go on to say that you can treat a horse without direct supervision, I'm not understanding how that makes sense. And then in turn, if you do that, then you will be creating a huge gap in access for people to receive care for their horses. So in order for a horse to get some care from a PT, a vet would have to literally go with them to the barn or to the person's ranch to get treatment by the PT, which was already authorized by the veterinarian by referral to allow for indirect supervision of that PT. So now you're going to add another element on there, which seems egregious. The other point that I wanted to bring up is about coursework being accredited in these rehab programs. They are actually accredited by RACE, and as you know, that RACE is the industry standard for veterinary medicine. So for coursework, so the coursework that you say are not accredited, that's patently false. The coursework is accredited, and that just doesn't come through at all in your comments about this. And then I also just wanted to bring up that there is likely that this board is in the crosshairs of the Federal Trade Commission and the crosshairs of antitrust and restraint of trade. By restraining a trade of other qualified professionals and monopolizing a specialized field would be unlawful. So I just wanted to bring that up as well. Thank you so much. Bye-bye.
Our next public comment comes from Emily McKay. Your microphone is unmuted.
Hi, can you guys hear me?
We can.
Perfect. My name is Emily McKay. I'm actually a physical therapist that works with small animal at UC Davis. And I just wanted to make a comment on the certification process, kind of what Karen Atlas was saying. I actually received my CCRP through University of Tennessee. They did it a little bit differently, where I had to go to Tennessee and take an in-person written exam, as well as an in-person practical, and we had to get a 75% to pass and receive our certification. So there are other certifications out there that are making sure we are qualified. I just wanted y'all to know that it's not just CRI is not the only option. There are others out there. So thank you for listening to me.
Our next public comment comes from Diane Francis. Your microphone is unmuted.
Thank you. Actually, this is Elizabeth Reed. My microphone didn't work earlier. So a statement was made several times regarding the human versus animal PTs are not comparable because animals can't talk. I'd like to refute that statement in people's thinking. Of course, a stroke victim or somebody who suffered a brain injury, a traumatic brain injury, may not be able to talk. They may be able to vocalize, as can an animal. They may be able to react by jerking away or changing how they are comporting themselves. So I don't think it's, I believe it's a specious argument to say that it's not comparable on that basis. Animals communicate, people communicate. It doesn't require a set of words. Thank you.
Our next public comment comes from a Kristen Hagler. Your microphone is unmuted.
Thank you for the time, you guys. I would like to just provide a quick little comment about the educational pathways for the board's perspective to consider. The two certification schools that have been previously mentioned, that they are, yes, RACE approved. However, I myself could also become a RACE approved provider. So just as perspective on how that process occurs, because I am a subject matter expert. So that does not necessarily hold for everything. These programs also do not have any maintenance of certification, such as with the Academy of Physical Rehabilitation Veterinary Technicians does. and the American College of Veterinary Sports Medicine Rehabilitation, that those programs require maintenance of certification to ensure the members are indeed participating in the field and staying up on the science and technology. There is one school that has not been mentioned. It is actually provides a diploma to its attendees. It's the Healing Oasis Wellness Center, and it is in Sullivan, Wisconsin, and it is the only school in the United States that provides a diploma to its people who graduate and have to follow the accreditation standards for the United States in education. Thank you for the time.
This is the moderator. We have received no additional requests for public comment. Would you like me to close this feature?
Yes, please, Madam Moderator. So that leads us to any more further comments from the board, and if not, we'll call for the vote. We have a motion and a second. And I don't see any hands raised, or who can't raise their hand, they can just jump in here. Okay. So, Jessica, would you call the roll?
Ms. Bowler.
Sorry, aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Dr. Nunez?
Yes.
Dr. Waterhouse?
Yes.
Ms. Yanis?
No.
Dr. Noland?
Yes.
Motion carries.
Okay, so correct me if I'm wrong, Jessica, but I believe that's the last of our agenda items.
Yes, it is.
So I think that it's time to go ahead and call this meeting to a closure. Thank you all for participating. Oh, Kathy has something to say. Kathy?
You're muted, Kathy.
But
Sorry. Sorry. I just wanted a clarification question because of the new materials. So I know we approved just now the responses, but we're having the hearing. So we're holding things still until the October meeting to address these additional materials that came in late yesterday. Is that the situation? I'm just clarifying here.
Correct. So by law, we have to respond to every substantive comment. And so if there's comments that we have been unable to respond to today, then we will be bringing them to the board during October. We're not going to have a whole new hearing. We're only going to be addressing the comments received within the window of the public hearing.
Okay, that's terrific, because I hadn't had a chance to read that last material either. But now I understand. So everything is on hold until after we finish in October with our comments. Is that correct?
Correct.
Thank you for that clarification.
Mark has his hand up also.
Do you want us to address any of the wildlife issues that were brought up? Or do you want to do that in October?
I think we're going to do that in October as well. We need time to, I think we need to give the board staff time to do that.
I mean, I just a couple of thoughts on that. It goes back to the VCPR with wildlife rehabilitation. I'm not exactly sure who the client is. Maybe it's God. So I'm not sure if there's like a VCPR that's established when wildlife is being rehabilitated. And also, unfortunately, a lot of things go back to legal issues. The practicing veterinary medicine is oftentimes a contract between the giver and the receiver, and I don't think that there's any money exchanged between people that are doing wildlife rehabilitation. That might be some points to consider when we're thinking about this argument.
Okay, and I think it looks like Christina had her hand up.
Yeah, would you be able to just walk me past the next comment, like what kind of just to go expand beyond what Kathy asked, so then we formulate our responses, and then what happens?
So all of the responses will go into the board's final statement of reasons, which will be posted on our website. And so it's in the final stages of the rulemaking process. So anything that we approve today are already going to be put into the FSR, and then anything in October will also be discussed and approved, and whatever's approved, we'll put it into the FSR as well.
And then that's it.
Right.
Kathy, your hand's up again, or did you not drop it?
No, I put it back up. Sorry, because Mark reminded me. So the wildlife rehab comment and alternative language, that is also going to be dealt with in October. Is that correct? Yeah, I see you're nodding. So.
Yes, and there are some nuances that are going to take a little bit of deliberation on the board's part. We need to take new due diligence with it.
Great, thank you. I just wanted to confirm that.
Okay, so anyone else? If no other comments, I'd like to adjourn this meeting of the Veterinary Medical Board. And thank you all very much for your time and your effort, and the public as well. Thank you. Bye, guys.
Bye, everybody.